sure I sit alone.
Okay, so we're back. We have Garth, but only on audio. Okay, so you guys are gonna have to do without his beautiful face, but his voice will make do. Okay, Avi, you were kind of on a roll there. You want me to just switch it over to the video scene, and we'll just start playing some insane ramblings?
Let's go right through it. Let's go through the deranged lunatic rambling. Okay, so let's
Hi,
start.
Jeff Nelson for tuning in. I've been involved in the plant-based world since about 1990. I understand that when people decide to go plant-based, they might have a lot of questions. So who can you trust? Who should you listen to? Should you listen to a vegan doctor or expert? Absolutely. But understand that not all vegan doctors are created equal, and take that into account. That's what I'm going to talk about today, and I'm here to...
Okay, so right off the bat, I just want to strongly disagree with trusting any doctor, let alone vegan doctors, when they make empirical claims. I think empirical claims, whether they're made by a vegan doctor or non-vegan doctor, or whatever type of vegan doctor that he's mentioning, should just simply be evaluated upon the merits of what the claim is, so that the evidence supporting it, and if those inferences are valid or not. So no, if the point of the video is to not trust me, I agree. Don't trust me. Don't trust the other vegan doctors either. Evaluate the arguments and evidence that we present for our claims, and that's how you should approach it. Don't approach this with, I don't advocate blind trust for any doctor. And I don't think Garth does either.
No, I just want to know what makes him the expert in telling people who to trust.
Well, that's...
Well, it's his credentials as a doctor, obviously.
But he doesn't have, I mean,
It's-
Jeff
I'm
doesn't
joking,
have credentials.
Yeah, he doesn't. He's being facetious. Yeah.
Yeah, I mean,
Sorry, we make
Jeff's
fun
the-
of Jeff a lot here. Yeah.
All right, we'll
to
continue.
who's a fake vegan doctor and who's real. All right, in recent years, lots of new people have gone
Can you pause it
plant-based.
for a
and
second?
this
Also,
Yeah, sure.
we've made this point once or twice, but is it that you're a fake vegan, or a fake doctor, or a fake vegan and a fake doctor?
Yeah, exactly.
And what's the evidence for any of those?
Right.
Like,
When I
does he-
saw it originally, it was unclear. Is he saying that I'm secretly eating ribs cooked in butter in my free time, or did I get my medical diploma out of a Cracker Jack box, or did I do both of those things?
I mean, who knows? Maybe it's conjunction. Maybe Garth's like a fake vegan, you're a fake doctor, Danielle's both. Who knows?
Garth, by the way, when I'm playing it, can you see it when you're on video right now? Because I
yeah, I
see
can see
that
it.
you're on. Oh no, actually, he's audio. Okay, perfect. Actually,
includes
all right, perfect.
of
So let's
doctors, and it's great. There have been a series of popular plant-based documentaries that have come along which have attracted many, many new people. These films spotlight the work of lifestyle medicine doctors like
pause it.
Esselstyn,
You gotta point out he'd be pretty triggered to know that James, the guy who made Game Changers, he's a good friend with Avi. Well, maybe good friends in North, and they're definitely buddies, and he takes from Avi hugely. Like, Avi corrected some of the false claims in that movie, unlike Jeff Nelson. What's James' last name again?
Wilkes.
James Wilkes, right? Yeah, he's a nice guy. Unlike Jeff Nelson, when Avi pointed out false claims, James was like, well, wait, why would it be false? And he looked into it and then went, oh, okay, you're right. I guess I'll just have to change what I'm saying. That's a mark of good character, right? Because you'd picture someone like that being, heavily invested in what they've, gone on record in a popular movie saying. But, James isn't an ideologue, right? So when the data was against him, he just looked at it, understood he was wrong, and corrected his point of view. I don't know why Jeff can't do the same.
Right. And neither can a number of people he's about to be citing. But let's
McDougall,
continue.
Bernard, Ornish, Letterman, and many others.
We have to
Broadly
pause
speaking,
again. We have to. How many?
Yeah,
Was that 2 or 3 of those people who are hiding from debate with you right now? Who is there? We had.
Let's see.
Oh, no, just 2.
So
Right.
two. Yeah. Esselstyn
right.
and Esselstyn and Ornish are hiding from.
Right,
are
both
refusing to engage me in debate.
Both of whom Nelson insists are correct with respect to their disagreement with Avi. Yet he won't actually provide any kind of clear argument for their position or defend their reasoning in a conversation. But they're right. Trust them. They meet Jeff's criteria for who to trust. It's almost like the criteria is just, do they support Jeff's preconceived beliefs? But Who am I to say? All
The,
right,
fu-
sorry.
the funny thing is that Esselstyn and McDougall have had fights before, and Esselstyn and Ornish, they're not all on the same page. And Jeff is a like McDougall. He's like a Trumpster, but a McDougallster. Like anything that McDougall says, is fact. Now, I respect all of these doctors that are up there. Who's the last person?
I don't know.
Actually, I'm not sure who the next person is.
Sorry, buddy.
Is
I
that,
don't
is that
know
Zach
who you
Bush?
are.
I can't even tell. But the other four are, they've been pioneers in their fields, and I have a lot of respect for them. I disagree with them on several issues here and there, but all in all, they're good doctors. But we can argue with them, and that's part of medicine. I mean, what Jeff doesn't understand is that there's nuance in science, and that science can be argued, but there's no end all be all guru whose word is above and beyond anybody else's in any reproach.
Yeah, I think that we might need to make a stronger statement than that. That's fair if that's your view, but I think Esselstyn and Ornish need to be very heavily criticized as promoters of dangerous pseudoscience.
Absolutely, completely agree with that. Just making claims
Are you what
simply
you're
have
referring
not-
to? Is there kind of the idea that a plant-based diet is all you need in order to reverse heart disease?
Just the idea.
The-
Oh, sorry, Avi, go ahead.
The idea that it has been demonstrated that a plant-based diet reverses heart disease.
Okay.
I think that's a it's a false claim. It has not been shown that a plant-based diet reverses heart disease, and moreover, it has led a lot of patients to abandon medical therapy in favor of plant-based diets. There was a patient who recently was told, not going to say who it was, but it was told by their plant-based lifestyle doctor to stop taking their nitrates for their angina and chew on cabbage instead to get the dietary nitrates. So
That's
things
amazing.
like that.
Yeah.
No,
When you and Danielle first kind of came out against them, I took pause. I was like, well, I mean, plant-based diet is definitely good for heart disease. I think you and I were kind of talking about whether we should debate, but then we kind of end up on believing the same thing. And I kind of see the point, because I've started seeing this in my practice too. People thinking that plant-based diet is all you need. And if you do plant-based diet, you never need to see a doctor again. And that's very dangerous.
And even if it weren't dangerous, it would still be pseudoscience. But
yeah.
And the other thing is just with the language used, they're coming out against them. I mean, it's fair; it's not a false claim or anything. But it is worth pointing out, like, Avi was extraordinarily fair. He didn't come out guns blazing. He came out actually very politely saying, "I think you have some errors in your work. I think some of them are actually very important, and we ought to have a discussion about it." Right. So that's right. Actually, that was the tone that it started with, which people, when they hear came out against, they might get the impression that Avi just came out like friggin' going into battle. No, he was quite polite, quite reasonable, and it became very obvious that Esselstyn and Ornish are sophists who will not actually defend their views. The second that they know they're interacting with someone who's going to be able to show serious problems, they're out of there. And of course, those are debate offers that remain open. But yeah, I would like firmly label both those guys with dangerous pseudoscience promotion. You want to continue?
Yep.
Letterman, and many others.
Which, sorry,
Broadly
pause
speaking,
one more
there are
second.
really two.
I also haven't talked to Garth a lot, so I don't really know your views, Garth. But if we're taking stances that are stronger than you take, let it just be known to the audience. Obviously, we don't speak for Garth here. But
yeah, I mean, I have a lot of respect for Esselstyn and Ornish. Avi's not wrong. If you get into a debate on science, we could paint them into a corner on certain claims. There's no question. But I still have respect for what they did for the plant-based community, and they've helped a lot of patients. But the information, I agree with that. If you lead someone to this belief that if they just eat plants, they never have to worry about disease again, that is a huge misinformation and definitely pseudoscience.
Okay, cool.
Of doctors out there, lifestyle medicine doctors and conventional medicine doctors.
Okay, so here's his like big point here. It's like he's going to separate the vegan doctors into the vegan lifestyle medicine doctors and the vegan conventional medicine doctors. All right, we'll see what does he mean by that.
Conventional medicine can be very lucrative. Outrageously priced prescriptions, overpriced.
That is the stupidest.
Already we're
It's just so funny.
we're going to the shill memes.
I haven't even watched it yet, but it's like this is where fucking Jeff would start, right? A conspiracy that conventional medicine doctors are shills. Like, okay. And it's a weird,
So
I've never heard the separation before, but like, what in fact is there gonna even be a
so far he has not
between
outlined
being
a
both?
criteria.
Yes.
Yeah, that's the thing. It's not. I don't see why. First of all, he hasn't really outlined a clear criteria, and we'll see that. But he also doesn't give a reason why they're not exclusive.
Okay.
Why they are exclusive? Sorry. Why
Yeah,
they're exclusive.
it's just
Anyway,
such a funny way to go in on a critique,
Let's-
but okay.
watch the.
Fucking
Let's
Jeff
watch
Nelson.
the shill memes.
Overpriced testing, and even unnecessary surgeries and procedures. They combine to make doctors and pharmaceutical companies very wealthy. Conventional medicine isn't that effective with chronic diseases. Treating symptoms does not do anything to resolve underlying health issues. So conventional medicine can treat symptoms, but rarely do they provide real solutions.
Very often provide real solutions.
Well-
There are many times.
This
I
is
mean,
also this is so vague. Like when he says he hasn't really, like you pointed out, but now he's going in and making statements about people practicing conventional medicine, but he hasn't really defined the term. Like how exactly does he even mean that when he says that?
Well, I think he thinks that lifestyle medicine doctors, they just work on lifestyle. So if you come in with hypertension, there'll be no medical treatment whatsoever. It'll all be diet. If you come in with diabetes, it'll all be diet, etc. And the people he's talking about, if you go to Ornish or Esselstyn, who really don't practice, Ornish has his clinics, but they're not really practicing doctors anymore, especially not McDougall. But they're not going to treat you with any of the conventional treatments. They're not going to do medicine, and they're not going to do surgery. But if you go to the American College of Lifestyle Medicine, you will see thousands of doctors that do both, right? If you go to my clinic, I've got behavioral therapists, I've got 4 dietitians, we do an exercise class, I have an exercise physiologist. I talk to people every day, all day. I mean, Jeff has never sat across from a patient who weighs 350 pounds, who has diabetes and heart disease, and tried to make them better. And Jeff has no idea the difficulties involved in doing that. Jeff has done nothing for anybody except be a talking head. But every day I go to work, I wake up in the morning and I face the real illnesses that are out there, and I face it using everything at my disposal, and everything at my disposal includes lifestyle medicine, and surgery. It's a comprehensive approach, and I think if anybody's doing anything exclusively, then they're missing out on a full breadth of treatment.
Yeah,
Right,
so
that's exactly the point. I mean, the key here is that number one, lifestyle medicine and conventional medicine are not mutually exclusive. They can both be indicated, and they should both be utilized as indicated.
So
yeah.
Do you think they are fairly clear terms then?
Not the way he's present. No, I mean, we can have our
the way
own
Garth
terms.
just talked about them, it
Right.
sounded like he just kind of spelled it out. Like you're talking about things that have like conventional, traditionally been used, well, like surgery or I don't know, like taking medication.
So to be clear, so I agree that I understand the terms the way Garth is using them, but I don't. I think it's not clear the way Jeff has presented them. I don't think Jeff has provided a clear definition of those terms. If that's
So
the
American
question.
College of Lifestyle Medicine defines lifestyle medicine as treating as diet, exercise, movement, sleep, and stress.
Okay. Jeff actually will provide in the video later on. He'll provide some sort of like attempt at a definition for lifestyle, but medicine. But he has not provided a definition for conventional medicine.
Right, because he's basically just said conventional medicine is just the stuff where they make money for
Yeah.
big pharma and like shill or whatever.
Right.
So yeah, I mean, it would be important to get a clear idea of what he's talking about in both cases. But like, let's just assume he's saying something like what Garth is saying. Or you pulled that from what? So you said some like
The American College of Lifestyle Medicine.
I mean, that sounds like the kind of people who are going to have a reasonable definition of the term, right?
Yeah,
So
you would think so, right?
yeah, it's like, I mean, you guys are doctors, correct me as the layperson here, but like, I mean, it sounds like if lifestyle medicine is, what do we talk about? Like sleep, eating, exercise. You're kind of talking about like lifestyle habits, and then conventional medicine. It's weird it wouldn't include that, but whatever. Conventional medicine refers more to maybe like we could be talking about anything from like a surgery to taking medication, stuff like this.
Correct.
It's totally unclear that what the argument could possibly be that one of those exclusively is all that's needed to deal with the full set of medical issues that currently exist on the planet. Is that a fair statement?
Yeah. And it's also that they are not always last line. Like you can have first line in terms of conventional therapy, and you can have lifestyle medicine that's also first line. Let's continue, because that's going to be a point on.
Lifestyle medicine, by contrast, is not led by a pharmaceutical approach. It's based on empowering the patient to lead a healthy lifestyle. Patients are encouraged to create.
Okay, not that this matters in terms of what the validity or soundness of the arguments that are being made, but there is an enormous amount of money in lifestyle medicine. There's Medicaid reimbursement to the tune of millions of dollars to lifestyle medicine programs that have gotten approval for it. There's also an enormous amount of supplements that are being sold. There's an enormous amount of diet books that are being sold. There's an enormous amount of revenue coming from videos. It's not true that there's not a lot of money in lifestyle medicine. There's quite a bit of money in both of these things. Which one might outweigh the other, which is fine. I'm fine with both of those things. It's not an argument against either of them.
Yeah, see,
it's a false claim. Yeah.
Everyone who's watching should just note like what Avi said, right? He's basically saying, I can throw your argument back at you because this applies to lifestyle medicine too, but I'm not stupid enough to do that because it's a bad argument in the first place.
Right, exactly.
Yeah.
Create, safeguard their health with educated changes to their lifestyle. Now, that's not to say lifestyle medicine doctors don't sometimes prescribe drugs or use some of the tools of conventional medicine, but that's sort of a last resort.
Okay, so that shouldn't be done always as a last resort. In fact, oftentimes that someone has a condition, they should have both medication and lifestyle interventions as first line. All right, so that approach is actually not the correct approach for many diseases.
Yeah, we would need some kind of argument that lifestyle is always it's always going to be best for patients for lifestyle medicine to be the exclusive first line treatment. Right. What's the argument for that?
Yeah.
Community, there are both kinds of doctors. You have lifestyle medicine doctors and you have conventional medicine doctors, but here's the thing. The advice you get from plant-based conventional medicine doctors can be very different from what you'll get from plant-based lifestyle medicine doctors. And therein lies the problem. As I see it, there are so-called vegan conventional medicine doctors prominent on social media who are posing as lifestyle medicine doctors.
Posing as lifestyle medicine doctors.
Fakes, in other words.
Right, see, it's weird because the video, ostensibly is about you two and Danielle. So, presumably he's talking about you guys, but do any of you even claim to be lifestyle medicine doctors? Don't you all take a mixed bag approach?
Yeah, so to answer the question, to answer the question now, I would describe myself as someone who advocates both lifestyle medicine and conventional medicine as indicated. But actually, I've never described or marketed myself as a lifestyle medicine doctor. So to say that I've been posing as a lifestyle medicine doctor, I think that's funny. I don't recall anywhere that I've said I was a lifestyle medicine doctor. So to make the claim that I'm a fake somehow, presumably that would require him to show me or show the audience some example of me saying that I'm something that I'm not, or any of us saying that we are something that we're not.
I mean, he has plausible deniability. I didn't talk about you by name, but isn't like the video presumably supposed to be about you guys, and the claim he just made, as far as I know, doesn't apply to any of you. So just kind of weird. It's like a well poisoning based on something that's not actually true of any of you.
Yeah, I mean,
Yeah.
I do lifestyle medicine. I mean, it's a big part of my clinic. And I've been a speaker at the American College of Lifestyle Medicine. I've never seen Jeff at the American College of Lifestyle Medicine, nor have I seen any of the people that, well, I take that back. I have seen Orange there, but yeah, I mean, he's, you know, again, you can be both.
And just to be clear for everyone, I mean, it might be obvious, but Garth, you are in fact saying that you are someone who takes the both approach.
Oh, without a doubt, yeah.
Okay. Yeah, so Jeff actually it's weird because he's doing a lot of sketchy stuff here. He's like he's making this separation, and whether his definitions actually allow the separation like make any sense or whatever, who knows. But like if we kind of assume he's using definitions like you, it's weird because it's like lifestyle medicine gets to be it just borrows from conventional when it's funny. It's like, actually, you know what? I'm not even going to go down that pathway. It's fine. But what he needs to do is the core of this is he has to give some kind of argument for why lifestyle medicine exclusively as a first line treatment is what will maximize the well-being of patients, right? I was going to make another point, but it confused me when I tried to make it. So that's the core, right? And I highly doubt we're going to see that argument from him.
Yeah. We're going to continue going. Isaac, just can you enable screen sharing for when we get to the part where we have to go through studies?
You want me to go to the Discord right now?
No, not right now. I'm talking about the Zoom meeting. I'm gonna share the screen on.
No,
yeah.
There's no way I can.
Oh, okay.
Do that.
Oh, you can go through it in Discord then. That's fine. All right, never mind. That's
okay.
Fine. Okay.
Yeah, it would show up in your camera box.
Yeah.
All right. Yeah.
Oh, I see what you're saying. All right, cool.
In a minute, but my advice boils down to this. Take guidance and opinions from conventional medicine doctors, even when they're vegan, with a grain of salt. Conventional medicine doctors may not understand lifestyle medicine. They understand pills and procedures, but they may not know about or provide you with all your options. Dr. McDougall has pointed this out for decades.
Can't you say that in reverse?
Yeah, you can say it in reverse. Look, I would say take everyone's advice with a grain of salt. Don't blindly trust anyone. And their ideas stand on the data.
It's funny when you say it like that, because you're basically like, you know, question everybody, and then you realize it's actually kind of implicit in what Jeff's saying when he's saying just question this one side. That he's actually saying, well, don't question the other side.
Right. It's like, yeah. No, I mean, I would just say the same for the other for anyone. Okay.
I mean, I think that's the stupidest comment in the world. What an idiot! To say that you should question a lifestyle conventional medicine doctor. Now you're talking about someone who has everything at their fingertips to treat you. They've got the lifestyle and they've got medicines when needed and they got surgery. That's exactly the person you should be trusting. You shouldn't trust McDougall, who's got absolutely nothing. If you're a hammer, all the world's a nail. So all McDougall has at his disposal is his lifestyle program, and his very specific lifestyle program, not any kind of variance to his exact program. We, on the other hand, have multiple things, you know, that I could offer someone to lose weight, or that Danielle could offer someone for their heart disease. So it's God, it's just so stupid. I don't know. It's beyond dumb.
Well, it's also weird because it's like he's saying lifestyle good. Sorry, this is the point I was trying to make a minute ago. I keep wanting to make it, even though it's not totally clear in my head. It's like maybe someone can help me out here. It's like he wants to say lifestyle good, conventional bad, but then a lifestyle doctor is allowed to borrow from conventional medicine just to whatever degree is needed to like optimize treatment. But then a conventional medicine doctor doing the same, it's like there's some kind of problem there. Like, are they like a fake, or like does they just become a lifestyle? It's like he's trying to take the middle category of people who do both, which is the reasonable people, and call them lifestyle doctors. It's like, well, no, that sounds like the middle category.
He's clearly not a logical thinker.
No, I mean, there's no fucking way this guy ever took, like, you know, like, imagine Jeff in a formal logic course just failing.
It's just like, I watch this stuff and I just think this guy has got no experience whatsoever. He's never treated a patient. He has no idea what he's talking about. I've never seen him at a single scientific conference. And all he does is go on Google and pick whatever study fits his narrative. And I don't know. It's just, it's ridiculous. I don't know. Well, maybe we're even giving this guy too much time. But anyway, go on.
All right.
And our colleagues continue to do this. Can you imagine me as a doctor, you coming to me with heart disease, and say you had clogged arteries, and say I believe bypass surgery was good for you, and say or at least say it was good for you, and say I didn't know about it, or maybe I didn't like the people who were doing bypass surgery, and I just passed it over for those reasons? Can you imagine what would happen if that surgery was of value to you and I didn't offer it to you? I'd be at least considered a terrible doctor if my license wouldn't be revoked. What happens when a patient comes to a doctor with type 2 diabetes, which Dr. Kaufman told you this morning was due to the rich American diet, comes to you with clogged arteries, heart disease, and a highly effective, scientifically established approach to the problem is ignored or discounted and not given to you, which is diet and lifestyle change. And it happens every day in 99.99% of the cases, and my colleagues get away with it, and it needs to be stopped.
Okay, so like both of those things, both the arguments can be made both ways. So yes, you should not hide lifestyle interventions from your patients. You should also not hide medicine from your patients. Or surgical interventions.
Which McDougall just proved our point there, right? He said, wouldn't it be terrible if I didn't offer you the bypass surgery you need?
Yeah. It's funny how many of these points run the other way.
Yeah.
Here is the definition of lifestyle medicine. You can freeze this frame if you want and read it. This is from the American College of Lifestyle Medicine, which was started a dozen or so years ago. In 2011, they started putting on conferences in College of Lifestyle Medicine,
actually
which
go
was
back
started.
for,
You can freeze this frame.
All right, so lifestyle medicine is the use of evidence-based lifestyle therapeutic intervention, including a whole food, plant-predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection as a primary modality delivered by clinicians trained and certified in the specialty to prevent, treat, and often reverse chronic disease. Okay, I don't know what exactly they mean by primary modality, but I don't see how this is incompatible with conventional medicine. You can use, if what you mean by lifestyle medicine is using evidence-based lifestyle therapeutic interventions, whole food plant predominant eating patterns, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections, you can do that in conjunction with indicated medical therapy, with indicated surgical therapy as well.
Yeah, there's a little weirdness here, because when they say primary modality is an interesting word to use there, but there's two things that kind of seem relevant here. First of all, you can have two things that are primary, right? If you say you have like, a set of sets, and each element in that set has each element in that set is a set with two elements, right? The primary element in the larger set has two elements in it, right? So it's like you could have two primary things, right? You could have a primary. You could have so say that one of those subsets in the larger set is lifestyle medicine and conventional medicine. That set of two elements could be the primary element in the larger set, right? So the point there is just it's not clear why lifestyle medicine as a primary modality would exclude conventional medicine as a primary modality, because primacy doesn't imply exclusivity, right? You have two things that are primary, right? And this set theory thing is just an example, right? The primary element in the set can be a set of two items. And then the other thing to point out is, aren't there cases actually where lifestyle medicine should not be a primary modality? Like cases where there's just some conventional treatment that should be sort of like first line?
Well, yeah, I mean, there's clearly examples of that. Clearest example is in emergencies. If someone is having an acute ST segment elevation, you're going to put a stent in them, unless you're not going. What you're not going to do is you're not going to just prescribe lifestyle intervention when they're having a STEMI, or when they're having an NSTEMI even.
Right. So like I assume you would agree with both those points. So primary does not mean exclusive, right? You can have your primary modality.
When I see a patient for weight loss, my primary modality, I tell them all the time, is lifestyle changes. Now, I might do a surgery to help them I always call the surgery a tool, or I might prescribe a medication to help them make the lifestyle change, but the lifestyle change is my primary modality, but I use other modalities with it.
Well, I guess I wanted to point out that primary doesn't mean exclusive, right? You can have two things that are both primary, right? Like that's kind of what I was pointing out with set theory.
They may be using a different. They may not be using the set theory definition of primary.
Well, I'm just talking.
Yeah.
I don't know what else primary would.
Yeah.
You don't have to talk about it in terms of set theory. It's just, why does primary have to be exclusive? Why is there only one primary thing, right? Because it just assumes that things don't come in sets, right? It's like the primary modality could be the combination of these two things. Doesn't that make sense?
I understand that. I understand. It depends on how they're using the word primary.
And then the other thing is that it's not always right to have it as the primary modality, which might be actually a criticism of lifestyle medicine. Yeah.
If you want, and this is from the American College of Lifestyle Medicine, which was started a dozen or so years ago. In 2011, they started putting on conferences for the public. Their conferences were practically identical to the events my wife and I started putting on 10 years earlier than that, with all of the same speakers giving the same talks and so on. So I've been involved in helping promote lifestyle medicine for decades, long before it became hip. Lifestyle medicine doctors often expose the weaknesses and uselessness of many conventional medicine treatments. It's important to do that so
Isn't that just something else that can be said the other way around also?
Sure. That's completely not true. There's not. He doesn't go to these American College of Lifestyle Medicine meetings. No one's in there saying conventional medicine is false and it's bad and we shouldn't do it. That is absolutely false. Most of the people there are endocrinologists and other kind of medical doctors that believe very solidly in medicine, believe in vaccines and all that kind of stuff. They just believe lifestyle is another treatment course to add to the patient's care.
Yeah.
People realize most standard medical approaches are not going to save them, and so that they had better look at diet and lifestyle, which can. Again, Dr. McDougall has been discussing this for decades, exposing the major problems of conventional medicine.
This is a typical patient. This is somebody who has high blood pressure, type 2 diabetes, high cholesterol, high triglycerides, gout, an element of kidney failure, overweight, mildly arthritic, constipated, and depressed, and this is not an exaggeration. And they ask for help. And the doctor sincerely tries to help them, but unfortunately they have a bag full of useless, harmful tools, by and large. Please, let me know there are exceptions. If I get in an auto accident, don't meet me in the emergency room with a baked potato and a carrot, okay? But I'm talking to you about the chronic diseases that are due to diet and lifestyle. They have nothing to offer you but useless, harmful drugs that are very expensive.
Okay, well, that's not true. They're not used. We have plenty to offer them to manage these conditions. And we also have lifestyle to offer them to manage the conditions and may treat underlying causes as well. I mean, it's not to say that our medications for those diseases are useless. It's just completely not true. It's just a false claim.
That's ridiculous. He's going to say that insulin is useless for diabetes, or is he going to say that a statin is useless for heart disease? And we got so much data on this. It's ridiculous to even bring it up.
All right.
Expensive. That will bankrupt you. That will take your home, your family earnings away from you. A well-treated patient is the patient that you see on your right. What's the difference? What do you see different? Nothing. They're still fat and sick. They're just carrying around a bag full of drugs and a thinner wallet. That's all.
Like, imagine if I gave an anecdote and took someone 2 years later with a bag of lettuce and I said, like, hey, therefore, a plant-based diet doesn't work because here's this anecdote where, someone's still, sick. I mean, this is the level we're operating on.
Does he actually provide any data in this entire presentation? That,
I don't know about this presentation, but McDougall's very low on data. He doesn't do any prospective studies. You would think with all the stuff that they have that there would be some good prospective studies. He had one on rheumatoid arthritis that was mediocre, but really not good, prospective studies. So I have, in my clinic in Houston, I had a weight management clinic, which was had a lifestyle component, had a surgical component. Obviously, I'm very interested in the lifestyle. At one point, my partner, who was my father, said, "Okay, well, let's do a competition. I don't do any lifestyle with my patients, and I bet you my patients do just as well as yours. If I'm going to do surgery on them, you do your plant-based diets on them." So we did a prospective study. It wasn't very large, but in the end, at a year, his patients were doing better than my plant-based diet patients, not the ones that had surgery, but my plant-based diet versus his surgery patients. And so he said to me, he made the statement, my father did, and said, "Looking at this data that we're looking at right here, this plant-based program that you're running to the clinic is malpractice." And I was like, "How could you call it malpractice? It's lifestyle medicine." He goes, "Because you're telling these people that the lifestyle medicine is just as good or better than the surgery I'm providing them. But look at what the data shows. It shows that the surgery with no lifestyle whatsoever is better than that." Well, if you look at its Cleveland Clinic, there's been several lifestyle medicine, the Swedish obesity study, where they took lifestyle medicine and they tested it against pure surgery with no lifestyle medicine at all. And the pure surgery group always beats the lifestyle medicine group. And so that's real data. What he's providing is anecdote. If you look at the real data, I don't believe this, but if you look at the real data, you could make the comment my father makes, is that saying that someone should do lifestyle medicine is actually malpractice.
To be clear, to say someone should do lifestyle medicine to the exclusion of indicated surgery. Yes, yes, I would agree with
now,
that.
Obviously, what I do is I've come to just really combine the two together.
Right.
Again, my primary component is to teach people lifestyle. I use surgery and medicine to help them reach that lifestyle change.
But Garth, why would you do that? Why not just dogmatically cling to lifestyle medicine ideology? Wouldn't that be more sensible?
It would be sensible if that's what the data shows me, but I always go by the data.
No difference.
And I do not go by, the worst thing to me is this, a anecdote. Because always what happens in an anecdote, people, they're always like, I always get some, if you go through my Instagram, you'll see some pictures of patients, and I've got surgery patients and lifestyle patients that I put on there. But I always get hesitant putting them on because it's such an anecdote, and taking one patient's anecdote is such a dangerous thing. And I'll tell you one example is I just did a live last week with one of my patients who I had put all over my Instagram because he was such a huge success, and we did a triathlon together. He was 500 pounds. Then we got down to 220 pounds, did an Ironman, and that was my pictures all over my Instagram and my social media. 2 years later, he's gained 50 pounds back. And so if I was just doing the anecdote back then, it looks like, oh, everybody gets down to 220 and that's everybody loses 250 pounds, but that's not the fact. And it's a little bit of a lie to use that, because these anecdotes, you're looking at what's a cross-sectional. You're looking at them at one point in time. Let me see this guy 10 years from now after McDougall's done with him,
Yeah, and let us see a bunch of other people in similar conditions and what the kind of trend. Yeah, exactly. I just can't help but like picture someone like Jeff Nelson like trying to take just like an intro logic course or like an intro stats course and just like having utterly no idea.
What I would really like, people like this, what I'd really like to do, because they've got no idea, they don't and look, I mean, I don't want to ever put down lifestyle because I believe in it. Look at Jeff. He looks freaking good, right? I mean, he practices what he preaches. He looks great for his age. It is good for you. That's why I practice it myself. But what I want Jeff to do is to come into my office and me send him into a room with my typical patients coming down from the Appalachian Mountains. I mean, the typical patient coming to McDougall is worried well or sick, but believing in the treatment that they're about to receive and has the money and the finances to go to California and get that treatment. That's not the patients I see. So I want him to go and see my 500-pound patient, treat him as best he can, and then see that patient back every month and see just how well his lifestyle medicine is working.
That's probably malpractice.
It's not going to happen. But what I want Jeff to understand, I want him to feel, is the difficulty in treating patients in a day-to-day basis in a medical practice. It's not what he thinks. It's not people at a retreat in California. that's not your typical patient that you're treating. And it's not people with a lot of money. It's not people with a lot of knowledge. And it's not people that are going to be highly compliant to these things that you're recommending to them. And it's a very frustrating job to try to treat patients. And I don't think that he understands that even in the slightest bit.
Yeah, it seems like a kind of theme of your criticisms here are that he is just, shockingly out of touch with the reality of what it's like to be a doctor, which is not surprising given that he's not a doctor. But
and he's also shockingly out of touch with science. Like, he never goes to a scientific meeting.
Right.
I think I haven't seen this, but I think at the part he criticizes me, he brings up an article where I was at the freaking meeting where we tore the article apart.
Mm-hmm.
But he wasn't there.
We'll get to that. Yeah.
He just Googled it. So that's the thing. He's just not a scientist.
Well, and I know we want to continue with the video, but this is the whole thing also about a live conversation, right? Because if you do these video responses, Jeff can take some time to Google things and give, some air of kind of knowing what he's talking about, even if, people who are kind of in the know can run a debunk on him. But in a live conversation, I'm sure it would come out that like he doesn't know a lot of like the basic terminology in, the areas that he's talking about. He just doesn't understand like basic kind of concepts in a lot of these areas. But, that would all come out in a live conversation. Avi would push down some road and Jeff wouldn't even know some of the terms he's using, right? So you can understand why he would avoid a situation like that.
Right.
Let's continue.
Don't put you in a situation where you have to worry about whether you're going to join Kaiser or PPO or what kind of health insurance you're going to get or what kind of doctor you're going to choose or what kind of brand of drug you're going to take, or get out of the business. And you can get out of the business, but you can only do it one way safely, and that's to be healthy. Sick people take drugs. Healthy people don't. Sick people wait in the doctor's office once a month for refills. Healthy people don't. And you can become healthy. I don't care how bad a shape you're in now, you can become healthier than you ever imagined. And almost everyone in this audience can get off all your drugs and avoid the majority of diseases by doing things that cost nothing, that you know everything about already after attending this weekend.
Those are
This
that's like something
so cringy. So actually disgusting. And because people who don't really understand the nature of the disease they have will hear this and be like, yeah, like it's almost like you're a failure if you are taking your medications because you haven't succeeded in doing the lifestyle to the point where you can get off medications. No, there are plenty of conditions where you're very likely not going to get off your medications, and you're going to be healthy with your medications, and you should be taking them, and you should be engaging in the lifestyle medication. And guess what? You're also not a failure if you don't get off your medications. There are some conditions where you may be able to get off of them. There are plenty of conditions where you're not indicated to get off of them, even with the lifestyle interventions, and that's okay. You can be healthy on medications with the right lifestyle as well. Like I want to be clear, this is the wrong message. It's actually, it sounds good. I know, like at first glance, this will sound like a great message. I want to be as clear as I can. This is a disgusting message. Horrific.
Right, and it's weird also because in a way, like earlier on, for example, he said like there's situations where you need conventional medicine. I don't know if he said conventional or whatever, but he's like, you get in a car accident, like yeah, you're gonna need like surgery or something. He said something like that, right? But it's oh, I'm not even sure. Sorry, I'm fucking in outer space. Whatever, continue. Oh yeah, no, I remember what I was gonna say. Sorry, yeah. He says that, right? But it's like so he kind of can save his ass by whenever you bring up an instance where you obviously need conventional medicine. He's like, well, I acknowledge there's cases where you need it, right? He could say that given what he said here, but it's very clear that the overall thrust of what he's saying is like basically you're kind of like a dupe if you're going with conventional medicine. You've like failed to be healthy with the means that work. You've been like fooled by these shill doctors. So it's like, okay, you might cover your ass by saying like if you get in a car accident, you might need surgery or whatever. But like, it's like the thrust of what he's saying is fucked. And if that advice were taken by a lot of people, we have reason to think a lot of their health would decline. And additionally, like no argument is given for why it would maximize their health to do this.
Yeah, I mean, I look at it's like fat shaming, right? You take my patients, you say you're fat and it's all your fault. Meanwhile, you haven't walked a mile in these people's feet shoes. You know, there's a million. They have a long family history of obesity. Um, their socioeconomic situation, their traumatic past childhood. Most of these patients have been dieting since they were tiny. If you do functional MRIs of their brains, it's a totally different looking brain than the brain of a normal weight person. And we know that they've got decreased dopamine receptors, and they have different responses to food cues than other people do. And so it's really a very complex thing, obesity, and it just isn't treated by saying, hey, you're fat and you could get better. That never works. It doesn't work. I don't care. I'll take on I'll take on anybody out there and offer a $25,000 prize if you could do better at 5 years weight loss than what I could do.
Business. Thank you very much.
Now let's look at a vegan doctor who is not a lifestyle medicine doctor, but a conventional
Okay, so just
medicine.
pause for a second. So it's because when we cut in and give commentary, it's easy to forget like what's happened in the video. But like, so far he's opened up. He's implied that conventional medicine is like an attempt to get all your money by doctors who are working for big pharma or some fucking crazy shit like that. Played a clip of McDougal ranting like a fucking unhinged lunatic, and now he's set the scene, so now we're going in for some more. This is great. Amazing start to a video.
And I'll also add that a further claim was made. He's saying, let's look at a doctor who is not a lifestyle medicine doctor. So now it's not implicit anymore. It's been claimed that the doctor he's going to mention is not a lifestyle medicine doctor. So he is making a claim with respect to that doctor that it's exclusive. They are exclusively conventional.
Doctor, cardiologist, Dr. Danielle Belardo. Dr. Belardo is one of the vegan critics.
Pause. He could have a weasel pathway of saying he's just saying she's not exclusively a lifestyle medicine doctor.
She's saying she okay, but he didn't. I mean, he's saying she is not a. No, she's saying he said she is not a lifestyle medicine doctor. Now, if he wants to say by not a lifestyle medicine doctor, I mean not an exclusively lifestyle medicine doctor, I mean he could change that, but I don't know why we would assume the exclusive part.
I'm just saying there's a weasel pathway there, because if we're about to go, well, like, look, I mean, Danielle clearly is like approving of some amount of lifestyle medicine, right? He could just back his claim up to, well, I just meant she's not doing exclusively lifestyle medicine. But, you know, whatever. Let's
all right, if he wants to say that, it's fine. It's just that exclusively lifestyle medicine is dangerous. Anyway.
Right.
Critics of actual lifestyle doctors Ornish and Esselstyn. Here, Dr. Belardo describes in a recent podcast her response when a cardiology patient came to her and asked for her help to use lifestyle medicine in his situation.
We told him absolutely not. Not only do you need to be on your dual antiplatelet therapy, you need to be on a high intensity statin, you need to be on a PCSK9 inhibitor, you also need coronary artery bypass surgery.
So basically, this is what Dr. McDougal was talking about. The patient on the right in Dr. McDougal's slide, the one holding the bag of drugs but not doing much better, this is a patient following conventional medicine. It's the opposite of lifestyle medicine, but it's very lucrative for the doctor and the medical system.
This is really disgusting.
Now contrast Dr. Belardo's conventional medicine approach to someone with advanced heart disease who used lifestyle medicine. Here's a 44-year-old man. He had a heart attack.
Oh, great. Here we go.
Yeah.
Here we go.
Yep. The quantitative, the angiography, not even quantitative, the angiography slides, the ultimate cherry pick anecdotes that are created around by Esselstyn.
And also, why is he doing just comparing one Danielle patient to this one person? That's one point. And then the other point is, why does he know that the patient Danielle's talking about wasn't someone who actually should be on said medicine? Like, he seems to, the only thing I can infer here is it's like he thinks that it's like universally quantified, right? That you should always, that like there just isn't a situation where you would make the kind of prescriptions that Danielle just made there, right? Because how else, unless it was a universally quantified statement, would he be able to, without knowing who the statement applies to, say that the statement is wrong, right? You follow me on that one?
And I'm also, the further irony is, I'm also pretty sure, I could rewatch the video, but I'm also pretty sure this is a patient that she advised to go on these conventional therapies, refused them, went to do a reversal plant-based diet, and then had a massive heart attack. But Yeah.
Like, isn't it crazy though that he's, without actually knowing, like this again probably, I mean, it's probably this, what I'm about to point out probably seems even more obvious to you guys as doctors, but like this just seems like such an example of Jeff like being in over his head, having no clue what he's talking about, right? Like, he doesn't know who the patient is. He doesn't know their story. He hasn't seen their like medical records or the kind of thing that any competent doctor would presumably want to say before making like specific prescriptions for them, as opposed to just like general statements like eat healthy.
Oh no,
do
of
blah,
course,
blah, blah,
it's
right?
absolutely it's
just insane.
Yeah, no,
it's like
crazy
without looking at any kind of medical records, without having any kind of medical training. Just a side point. It's like he's just saying, well, you know, Danielle's statement that this guy should be whatever on his PCSK9 inhibitor, whatever the fuck she said, right?
Inhibitor,
right?
Statins, yeah.
Yeah, it's like he knows that's wrong without knowing who the patient is or what their situation is, right? How's that possible unless he just thinks in all situations, right? It seems like he just thinks it's always wrong to be prescribing those things, and it's like, wait, but what about the cases where like this is going to seriously benefit someone? And yeah, I doubt he has any data, but whatever, I could go on.
2007, he had an 80% blockage of his circumflex artery. He had other blockages as well, and his conventional medicine cardiologist had told him he needed conventional medicine. He told him probably something just like this.
We told him absolutely not. Not only do you need to be on your dual antiplatelet therapy, you need to be on a high intensity statin, you need to be on a PCSK9 inhibitor. You also need coronary artery bypass.
Okay, pause. Because I feel like I have a sense of like how this sounds to a layperson. Okay, because I think you guys are hearing these all as technical terms, knowing exactly what it refers to, right? But you know, to a layperson, this sounds like a bunch of scary medical shit, right? It sounds like I would be fucking horrified if someone told me, you know, like I do what the doctors are telling me. But if someone's saying, you know, you need coronary bypass surgery, you know, this and that, and then there's some other person there saying, you know, well, no, the doctor prescribing these kind of things, telling you to do these things, they're actually just like crazy, and like you're gonna go through all this medical horror when really like you could just be living healthy, right? Like that's the kind of thing that, like, if true, like it would be so worth knowing. But it's so, I don't know if I can capture it perfectly, but it's like so disgusting to paint that as if it's true, because I'm picturing these people who don't know anything about medicine, right? Who hear these scary words, they're already freaked out. It would already be like a bit of a, you know, like a jump for them to do what they need to for their health, which might be like going through with like surgeries or medications or whatever. And then you have fucking Jeff Nelson over here scaring them away from those treatments with the lie that, you know, this is going to do nothing for you and you should just be eating carrots.
Yeah.
Like, that's fucked. That's actually disgusting, right? And I guess why it's disgusting is like, A, it's like preying on these poor people who just don't know any better and are in a bad medical situation. But like, B, it's advice that if taken is sure to produce bad results, if not in an individual person, on aggregate, right? If everyone who's currently being given these prescriptions by doctors takes an exclusively lifestyle medicine solution, right? It's like that. There's going to be people who get really fucked by doing that.
Yeah.
Right.
No, I mean, the guy's a lunatic, obviously. We'll
That's right. So he was told he needed a lot of drugs and a bypass, and forget about lifestyle. You're too sick.
Do you know that he doesn't?
Yeah, and exactly.
Right?
Like,
have you
how
seen
do you know
his medical records?
He doesn't.
Like, can I ask you something? As a doctor, I assume it would be malpractice to make statements about what a specific, tell me if I'm wrong here, but what a specific patient should be doing, and not statements that are general, like that kind of apply to everyone, like eat healthy, right? Statements about specific, like, medical pathways, like what kind of surgeries they should and shouldn't take without looking at their medical records. Surely that would be malpractice, right?
No, it would be crazy.
So it's like Jeff's, the only reason it's not malpractice is because he's not a fucking doctor in the first place.
Yeah.
But if he were, it would be just absolute malpractice what he's doing here.
Of course.
But this patient heard about Dr. Esselstyn, and he'd purchased Dr. Esselstyn's book. He skipped the bypass, and all by himself, without having any cardiologist or doctor assisting him, he changed his diet and reversed his heart disease. He went from 80% blockage to no blockage.
Okay, two things I'll point out. Number one, it's an anecdote. Who cares? Number two, that's a different angle view of the artery. So I want to point out that you can make something as small as that 80% blockage, that's a 20% open lumen of the vessel. You can make that look like a fully patent an open vessel with zero blockage just by rotating the angle of the view that you're looking at that vessel from. That's why when you're doing these comparisons, you really need to make sure that you're looking at the vessel from the same angle. A small difference in the angle that you're looking at can actually make a difference between a 0% blockage and an 80% blockage, and vice versa.
Yeah, and like
So this, yeah, go ahead. Yeah, go ahead.
Oh, no, you go ahead.
Yeah, like this. So number one, it wouldn't matter even if true, because we don't infer causality from cherry-picked angiograms. But even within the lowest level of evidence that he's bringing, the anecdote, even within that the terrible quality of evidence, even that fails, because you can couldn't even infer that the blockage changed based on these two pictures.
And I don't. If you look at Ornish's data and all that stuff, no one goes from 80% to 0.
Yeah,
I mean they go from 80% to
79.5%.
You know.
Yeah.
I mean that kind of a change right there is not true. That's not real.
Well, and it's weird because like the impression you would get watching this Jeff video is like, put down, you know, the conventional medication that your doctor has prescribed to you, right? You can just count on getting, you know, like a 80% reversal of artery blockage by just eating plants. Like that's the claim, right? That's what's underlying all these shots. But it's like, will we actually be, you know, presented any data, anything like that?
And let me take a devil's advocate view a little bit, because
Please, yeah, go ahead.
there are doctors out there that will totally jump straight to do surgery when you don't need surgery, or get a stent when you don't need a stent. I mean, we know that angioplasty works well in a very acute situation, but not in a chronic situation. And so there are situations where I think people are getting stents and they don't need them, et cetera, et cetera. But aren't we saying here that who better to go and see? Like, you don't want to go and see one person, one extreme. You don't want to go see the doctor who's not going to tell you anything except get a stent. But you also don't want to go to the doctor who says don't do anything except eat a carrot. So couldn't there be anyone better to go and see than Dr. Belardo, who's going to sit down and go over all the different benefits and risks on both sides and give you a lifestyle program to go either exclusively or hand in hand with any treatment? And that's where Jeff's saying go with one extreme and avoid this middle ground person who's going to tell you everything. And that really is his real error, because you got someone who's going to do lifestyle and conventional, and that's what everybody should be searching for.
So it sounded like that turned back into a criticism of Jeff, but the devil's advocacy was just to say that there are some doctors who actually are, just like there's doctors who will stick exclusively to lifestyle or prescribe that first line when there should be something else first line. There's the reverse, and you guys will readily grant that, obviously, because you're not ideologues.
Exactly. Of course.
Right.
0. These are slides he sent to Dr. Esselstyn. So he reversed his heart disease with a book you can buy used on Amazon for $2. I've been talking about cardiology in my last couple of videos and how it's largely a failed specialty.
Imagine crazy. It would be like, because the thing is, Jeff's not gonna know, again, like maybe it feels petty to like harp on this, but Jeff isn't going to know like the basic terminology of the domain. He's not going to be able, like, if a cardiologist were just to assume a base level knowledge of cardiology in their interlocutor, right, and try to have a conversation with him, he wouldn't know what he's even talking about, right? Yet he feels like he's in a position to basically say like cardiology is just pseudoscience. It would be like someone who, you know, didn't know like what like propositions or like entailment or you know, modus ponens is, or something like this, trying to say logic is a failed discipline, or someone who doesn't know what fucking electrons are saying physics is a failed discipline, right? It's just comical.
It's such a bizarre. I mean, doesn't he know the data on the improvement in heart disease since the 1970s?
I mean, doesn't he know the data? It's of course he doesn't. He doesn't know fucking anything.
But it's very perplexing. It's like, how could someone be? It's stupid to ask in this, you know, post-Trump era. How could someone be so confident in their stupidity? That's always my question. How could someone be so confident in their stupidity?
It's really crazy because we can only speculate. It's like a psychological question. Like, maybe we need a psychologist here instead of just medical doctors. They could evaluate what the fuck's going on in that brain. But like, my best guess is he is just an ideologue. He just has certain kinds of ideological commitments, and he will jump through whatever crazy mental gymnastics are required to preserve them. That's what it looks like to me.
I operated on a guy today, 25-year-old with idiopathic cardiomyopathy, possibly post-infective. He's on an LVAD, so he's got a pump, in his heart.
Mhm.
Cardiologists have kept this guy alive for 5 years, waiting for a heart transplant. It failed cardiology. They saved this guy. I mean, completely saved it. What's Jeff going to do when he sees it? I mean, it's perplexing. It's so missing such a wider world. It's such a privileged view, like so privileged sitting up on his mountaintop in his rich home, making these comments. It's so ignorant.
Yeah, it's like
Yeah.
it's like I don't know the word for it, but Garth, you're really like your comments are all just drawing my attention to like just how like presumptuous and like insane it is for him to be. I don't know.
I just want to throw him into a room with a patient who's got a real problem and let him try to treat it. Here's a patient with AFib. Go for it, Jeff.
It's almost like it's almost like you're drawing attention to the fact that like he will like talk a big game about lifestyle medicine, blah blah blah. Here's how to live perfectly healthily, but like what it is? It's like in the same way that Avi knows he would just crumble the second he's put in a debate. He would crumble the second he's put in a context where he actually has to solve some of the problems he thinks he has the answer to in real life, like he's sitting across from the patient, right? Yeah, it's interesting.
The other thing I'd like him to do is go to one of our scientific conferences, because if you guys have never been to a scientific, well, Avi, you have, but you go to these conferences, we eat each other up. Well, I see here that you used the student's T-squared test. Why did you use that for your statistical analysis? Really getting at each other. Criticizing the literature, and he thinks he could just Google a paper and it's therefore fact. It's just so completely ridiculous that. I just go back to this idea that we live in this like post-factual, post-intellectual time now.
Yeah, I'd be astounded if Jeff even knows what student T distribution is.
No, he doesn't know that, and he's never been to a study like we'll get to it when he goes to mine, where I was actually at the conference where we were just eating the shit out of it, like this is the most ridiculous paper ever, and then that's the one he brings up to put on. Yeah.
Oh yeah, we I don't know if we already told you this, Garth, but we've got the archive with some of the debunks written up for the whatever data he apparently cites later in this video. So yeah, we'll get to it.
Yeah, and by the way, guys, I'm going to probably have to get out in just a few minutes, but
then in that case, we could probably skip to where he talks about your
Oh yeah, we need to do the part where he talks about Garth with Garth here, don't we?
Yeah. So let's do that then. Okay, so
we'll come back for the other crazy. Don't you guys worry.
Yeah.
Well, I don't want to take you guys off your.
No, it's worth it. All good. Don't worry about it.
All right, so let's go where he starts talking about Garth. Okay.
Now, Dr. Garth Davis, in fact, was on the board of that obesity conference that kicked out Dr. McDougall. He told me. And you can watch the video I made about this at the time. But the obesity conference, the purpose was to help educate other doctors on ways to make money treating obesity. That was the actual purpose of the conference. It was paid for by companies that sell obesity drugs and weight loss products. In 2013, the AMA designated obesity a disease. So if you watch my video, I showed the program for this obesity conference, and they had lots of courses on how to bill insurance companies, how to make obese patients repeat customers, how to use weight loss shakes, supplements, exercise machines, low-carb diets, bariatric surgery, etc. The conference objected to Dr. McDougall wanting to talk about 4 studies that showed a low-carb diet was harmful to heart health, thus not the ideal. Dr. McDougall has made his own video about this conference you can watch, but he was told it was a conference to teach different opinions, different options rather, that doctors could offer in their practices for obese patients. But it was not a conference to compare or criticize anyone else's approach. They didn't want Dr. McDougall comparing the plant-based diet to the keto diet because that could undermine other speakers at the conference who were pushing keto. You can watch
I don't see how any of that is relevant to myself, Dr. Davis, or Dr. Belardo.
My video on that, but my point is doctors like Dr. Belardo and Dr. Davis are involved in a very different kind of medicine than doctors using lifestyle medicine to get results. Dr. Avi is another plant. what
Oh, my
parameters
bad.
you
I should
choose to.
actually,
Likes to argue from
here we go.
authority, like, doctors know.
Oh, here we go. So
Plant-based,
here's the claims about
conventional
Garth.
medicine doctor giving advice on social media is Dr. Garth Davis. I like Garth. He likes to argue from authority, like, doctors know the research best. And I think Garth.
Okay, so claim number one is that you like to argue from authority and say doctors know the research best. Literally in the beginning of the video, we presumably agree that the claims stand on the evidence that is there to support them and the validity of the arguments.
Let me say
they're
he's not.
true. Yeah, sure.
He's not wrong about that. I do think doctors know the evidence best. I
Well-
do think I know the evidence better than he does. So he's not wrong about that. I think this idea that people are like, oh, that's an appeal to authority. Damn right, it's an appeal to authority. I've been studying this all my life. I know obesity a lot better than Jeff does. He doesn't have nearly the breadth of understanding of the disease process and the physiology and the different treatment protocols and what the science says about them and how to conduct a good scientific study. So I do go from position authority.
I just want to make a distinction, because I don't think simply pointing out that you know better than Jeff or you know best actually is an appeal to authority. An appeal to authority is saying that my statement is true, or a given proposition is true or false in virtue of my authority. And I don't think that's what you're saying. I think you're saying that the things I'm saying are true because of the data, and I just happen to know the data better.
Yeah, okay, sure.
Yeah,
so that actually wouldn't be an appeal to authority.
I mean, there's this other construal that a lot of people like of appeal to authority, where it's like there's the legit and the not legit appeal to authority, and the legit one is when you're pointing to someone who actually is an authority, which, I mean, in a sense, it's still an appeal to authority, but if you just want to say, like, sort of like inductively, it's like, the chances that they know what they're talking about are vastly higher if they are a medical doctor than not. It's like, yeah, I mean, that definitely raises the probability they know what they're talking about. But yeah, the core point surely is you wouldn't say I am right because I'm a doctor. You would say, correct me if I'm wrong, but I'm right because of the data. Doctors are likely to know more, but you're not saying that is why you're correct, right? It's not the truth maker.
Exactly. And I also have a breadth of knowledge, both how to read a paper, what papers exist in this specialty, both pro and con to my current belief. And I get to see those papers applied in a real life situation to see whether they're worthwhile. Like, it's hard to put this into a terms that people can understand, but just because there's a paper doesn't mean that is therefore fact and true. Like in obesity, there was a procedure that came out called the lap band, and there were a lot of procedures showing that the lap band worked very well. And I went to the different scientific meetings. I heard the arguments. I read the papers. I said, okay, this works well. So I started putting lap bands in people, and guess what? Worked like crap. And then I started to realize where the mistakes were with the way they were putting together the papers and some of the stuff that wasn't being told. And my breadth of experience allowed me to make that assessment. Someone Googling one paper wouldn't even know the beginning of whether or not a lap band works or doesn't. So I'm privy to a body of knowledge that Jeff just isn't privy to.
So yeah, just to close off that point, it's like, well, I don't know everything Garth said in the past. Maybe he did appeal to authority, but the position that, as far as I can tell, you just put on the record is you're not saying you are correct in virtue of being a doctor. You're saying you're correct in virtue of the data.
Yeah, the data, the evidence, and my experience of it.
Right. Okay.
Garth probably does know best if you're considering a stomach staple or a lap band or some other kind of bariatric surgery like what he does for a living. Bariatric surgeons cut people open and reroute their intestines to help them lose weight. I believe, and I may need to be corrected on this, but I believe Garth's father was a bariatric surgeon and Garth inherited the family business, so that's what he does. And bariatric surgery...
Not stop for a second. Not true. My father was a surgeon. I started the bariatric practice.
Okay.
It's also interesting how Jeff seems to think he knows very precisely where the borders of your medical knowledge are. It's a bit of a presumptuous thing to say, right?
That's so ridiculous.
Okay. Another false claim, not a surprise.
According to it has a 70% failure rate after 10 years.
Now, he
I
won't
mean,
cite this study. I tried to look for which paper this was.
it's not a paper. It never got approved for publishment. So this was we have a conference. It may be in the Sword Journal. I'm not sure if it actually ever got published, but part of our peer review is you got to present the article. So there were two articles presented at the conference. Again, he's not at the conference, right? Doesn't have the beginning faintest idea of how we put together these articles. So when we discuss success, we use a very arbitrary number, which we've criticized ourselves for because it is a very tough number to reach, and that is 50% excess weight loss is what we consider success. Now, keep in mind, let's say someone weighs 300 pounds and their ideal body weight is 200 pounds, so they're 100 pounds over ideal body weight. That would mean 50 pounds is our lowest marker. If you're 49 pounds, the surgery is a failure. But is 49 pounds a failure? So
No.
the best lifestyle medicine diet study ever on weight loss that showed the most weight loss ever after 1 year, keep in mind, just 1 year, was the Broad study. And in the Broad study, they lost an average of 25 pounds. They didn't do it by percentage of excess weight. I'm not sure exactly what it would be, but it would be not even close to that number, not even a fraction of that number, not even in the vicinity of 50% excess weight loss. Maybe it's 5% or 10%. Also know that just 5% of your body weight loss has huge effects on your comorbid illnesses. And so like our society is called the American Society of Bariatric and Metabolic Surgery. So we call it metabolic surgery because we don't really do the surgery necessarily for weight loss. It's not a cosmetic surgery. We're not doing it to help people lose weight. We're doing it because we get about an 85% remission in heart disease, in diabetes. We get about a 75% remission in reflux disease. We get about a 75% remission in sleep apnea. I mean, these numbers are just 85% remission in diabetes. I mean, that is just unheard of. And that's why we do the surgery. But again, going back to that paper, so that was a single institution study where they looked at 11 years out and saw that they had a 70% what we called recidivism rate, which again was the weight dropped below a 50% excess weight loss. The patient still had a considerable weight loss 11 years out. That is unfreaking believable. You don't get any other treatment that gets anything close to that kind of number. The other thing was they then presented another paper, which was a meta-analysis that looked at several different studies. Again, the N was low because previously we just didn't have long-term follow-up with patients. And we just don't have 11-year data. We got great 5-year data, and the 5-year excess weight losses. My 5-year excess weight loss, because I've got that data, is about 78% excess weight loss. That is, so again, in that person that was 300 pounds, they're now lost 78 pounds 5 years later. So that is pretty amazing data at 5 years with an 85% reduction in heart disease. But we just don't have 11-year data readily. But they did present a meta-analysis. I think there was a total in the meta-analysis of something like 350 patients. And the recidivism rate was 22 to 30%. So that is certainly not, that means, 70 to 80% of people are keeping over 50% of their excess weight loss off. That is such a humongous success. It's mind-blowing, which goes back to, when my father had that conversation with me, and my father's pretty brash and, definitely not a lifestyle. He's the kind of person that Jeff would not like. He was like, oh, it's medicine or nothing. And he would say, well, you look at that data and that data beats any kind of weight loss. Let me see McDougall do a study that shows that comes even close to that, even half of that. And therefore he would say it's malpractice to do lifestyle medicine. Obviously, I don't believe that. In fact, I look at the data and say, okay, that data is pretty good. Now, because my colleagues who do weight loss surgery really do not do good lifestyle medicine. Now let's combine weight loss surgery with lifestyle medicine. And that's where you start getting the results that I see, which are just really, amazing results. But the whole thing is just so offensive. I mean, Jeff never spent a day with a 500-pound patient. He has no idea how they suffer, how difficult their life is, the kind of just discrimination and this kind of talk, this kind of fat shaming that he puts against them, and doesn't understand just how hard it is in their life to lose that weight. And my life every day is just such a joy to be able to help these people out and to see such unbelievable life changes in my patients, running marathons, doing Ironman. For him to look on Google and find this, the first, if you look up on Google failure from gastric bypass, this is the first, that picture that you have right there is the first thing that comes up. And it's the first thing that he did. He Googled it, he found that, and now he's trying to speak as some kind of expert on weight loss surgery where he doesn't have the first idea. He called it stomach stapling. It's not stomach stapling. He called it lap band. I don't do lap band. He said that I inherited the practice. He's obviously a liar. He obviously has no idea what he's talking about.
See, it's possible he's actually such an ideologue that he doesn't realize he's lying. But either way, he's definitely wrong. So, and I was going to say one thing about what you said about your dad there, which is like, I mean, yeah, maybe that's too strong of a position because he ended up not being really in favor of the lifestyle medicine at all from the way you put it there. But there's something I like about that, though, about his approach, which was the element of like, I've got my data, you put yours on the table. Like, let's just see who's better. Like maybe he came to the wrong evaluation about what's better, and ultimately we should be doing both. But there's something nice about that. It's like let's just be empirical. Let's just put the data on the table, see who wins. I'm confident in what I have. Let's throw down.
That's what most doctors do. I mean, most doctors say, "Oh, show me the data." If you show me the data and it's good, great. And if it's not, there it goes. So, I mean, that's how medicine works. We go to these conferences, we present data, we read journals, and we come to conclusions on what's evidence-based medicine.
Yeah, just like Jeff.
Just like that. But I mean, this idea that gastric bypass fails 70% is just such an unbelievable. It's just such an unbelievable misinterpretation, and dangerous and sad for people that really could benefit from it.
Yeah.
Let's keep
What
going.
a disappointment. Garth and I have actually discussed this 70% failure rate analysis, and Garth disagrees with it. He told me he knows the bariatric surgeon who presented this analysis, calculating the 70% failure rate, and that Garth, disagrees with the paper. And the bariatric surgery field has other ways to gauge success, not just weight regain. And under different definitions, it can have a higher success rate. It just depends on how you define success and what parameters you choose to emphasize. But Garth also told me that he encourages his own.
But the key point here is that whatever criteria you're using to say that bariatric surgery has a 70% failure rate, if you applied that standard to anything, it would be an even worse failure rate. Imagine applying 50% excess weight loss percentage to plant-based diets or low-fat plant-based diets. It would look terrible.
Look, I've done a lot. Unlike these guys, I actually keep data, right? So we have databases, and it's frustrating and sad to see how poorly lifestyle medicine does when you really put it to the test. And I'm not criticizing lifestyle medicine. I still believe it's good. It's not the lifestyle medicine, right? It's not that plants don't work. It's that people don't eat plants, no matter how hard, and it's just difficult to get people to change. But when you really put it to the test, which is why I say I would love Jeff to come to my clinic, and give him 50 patients and give him 5 years and see what he does with them. It wouldn't look good. If I put them with McDougall, it wouldn't look good. The data just doesn't look good. And when you look at we had the Cleveland Clinic, who has really, they're not plant-based necessarily, but they're probably the most respected lifestyle medicine clinic in the country. And they did exactly what my father and I did. They had their lifestyle clinic program versus the bariatric program at Cleveland Clinic. And, you got to look that paper up. The results are dramatically better with the surgery and the intervention. And I know the surgeons over there, they're not doing any lifestyle medicine. So that's without the surgery group doing any lifestyle medicine. They just demolished the lifestyle medicine group in every factor, whether you're looking at weight loss, whether you're looking at recidivism, whether you're looking at diabetes.
So it sounds like you almost lean in the direction of like, yes, lifestyle medicine can be a useful complement, but overall, if you were actually forced to use only one or the other, you'd actually presumably go with conventional.
For obesity,
depending on the circumstances.
depending on the
but yeah.
disease process. I mean, for cholesterol, I think lifestyle medicine does a great job. Hypertension, I think lifestyle medicine does a great job. Diabetes, type 2 diabetes, I think lifestyle medicine does a great job. Obesity is just tough. I mean, obesity is just a really tough disease. And if I only had one tool in my box, yeah, I'm going to do what I know works. Because in the end, I'm sitting down across from a patient who's desperate, and I got to do for them what's going to, in the end, work for them. And the funny thing is, like the shill business and stuff like that. I'm a salaried physician, right? When I'm sitting down with a patient, we don't ever talk money. I don't even know how much their insurance pays and all that kind of stuff. That's all taken care of behind doors with money pinchers that I have nothing to do with whatsoever. In most clinics, the doctor just what you're making from the procedure just does not fit into your thought process when you're sitting with a patient. I've got many patients I've talked out of surgery. I've got every single one of my patients has to go on a lifestyle program before I ever operate on them. If they do very well in that program, we don't do surgery. And
Did
so,
did you talk them out of surgery by showing them Jeff's video?
yeah. I'm like, look at this one guy who did well.
All right, let's move.
Patients to eat based diet, and as a result he has better outcomes than other bariatric surgeons, and I don't doubt that, and that's really terrific. That's great for his patients. But my point is, Dr. Davis is not a lifestyle medicine doctor. He isn't reversing heart disease or type 2 diabetes or even obesity through lifestyle and diet that I know of, but through expensive surgery. And so
Or both.
Yes, or both. So he says, I'm not a lifestyle doctor. I want you to show me a doctor who has on his staff a full-time behavioral therapist, a full-time psychologist, 3 full-time dietitians, a full-time exercise therapist, who has a gym in his clinic, who does support groups, cooking classes, a relationship with a sleep program where we get people sleep, and we do stress management and meditation. Show me any physician that has all of that in their repertoire. I think if there's anybody in this country that's a lifestyle medicine doctor, it would be me. But I also use other forms of treatment. And by the way, I don't just do bariatric surgery, I do general surgery, but really general surgery doesn't really have a lifestyle component to it. If you've got an attack of appendicitis.
Yeah, I mean, it doesn't even sound like you're doing just a little lifestyle stuff. It sounds like you're doing like
intense.
a multi-pronged, just
we do
insane claim from Jeff here.
Yeah, no, we do. I do more intensive lifestyle than McDougall. Than the only person who could compete with the amount of lifestyle that I do with patients would be Ornish. His Ornish programs.
It's crazy to me that Jeff wouldn't take the time to surely this information about what your practice does is online. Don't you have a website or something?
I do. What's so weird about it is if you go to my Instagram or any of my social media, I really don't talk about surgery. Maybe I have 3 or 4 posts on surgery, and the vast majority of my posts are on lifestyle. They're on diet and plant-based diets and things like that. My book, Proteinaholic, I don't know if I mentioned surgery in there at all. And so it's just such a bizarre claim on his part, but it just goes to just further discredit him. I mean, anybody that knows me and has seen me on social media and stuff like that know that I'm not selling surgery anywhere. I don't have any surgery commercials. There's no commercial of me talking about surgery anywhere.
Let's continue then.
when he disagrees with doctors Ornish, Esselstyn, or McDougall and others, as he does, I consider what each of these doctors are actually clinically good at in real life, as opposed to Dr. Davis reading some studies, usually studies from drug or food companies.
Well, pause this. This is insane. Wait, he's effectively just saying, I just look at my impression of what these doctors do instead of doing what fucking Garth does and looking at studies. It's wait, what? You can say it in a negative light, but that's not reasonable. It's not a reasonable thing to do.
And he says that the studies are from pharma and things like that. When you go to a scientific conference, which Jeff has never done, everybody that gets up there has to say, any kind of conflict that they have, any kind of money that they've received from any kind of company. Secondly, when I go to conferences, I go to two main conferences. One is it's basically called Obesity Week. And so half of that conference is with the Obesity Society, which is mainly papers on nutrition, no pharma, nothing like that. And then I go to the surgical, and there's no drug company with any of the surgery stuff. It's all surgeons and their experience with surgery. There's no conflicting companies or anything like that. So this idea that that he's somehow free of any kind of bias, but that I am biased, is just so completely wrong.
There's like two things. Like, first of all, avoiding industry research is in itself a bias, right? That should be mentioned.
Of course. Yeah.
And then additionally, what is with like throwing this shade at like industry research? Like, sure, there might be people funding things because they think they'll get certain results or whatever, but bottom line, doesn't matter where the funding comes from. What matters is one thing, and one thing alone. Well, I was going to say the methodology, but we're effectively saying the same thing. It's like, was the study done correctly? What does it say? Like, that's what matters, not where the money came from. Right. Where the money came from is at best maybe like a kind of indication of, you know, what kind of areas of the study you might want to look out for maybe, you know, maybe there might be an attempt to get a certain kind of result there. It could give you an indication, but it's like, bottom line, you know, you could have a study funded by collaboratively all the worst people in the world. You know, like Hitler chipped in a few bucks, and like, you know, we got a little money from Stalin, and we ran some kind of study and did it with a correct methodology and found a result. It's like, well, I don't care where the funding came from. That is just going to be accurate information if the methodology was right.
Absolutely. Yeah, exactly.
And giving theoretical advice to vegans. Some years back, I made a video called McDougall, You're Fired, and it was about Dr. McDougall being invited to speak at an obesity conference. And then when they saw what Dr. McDougall was going to say, they revoked his invite and kicked him out. Now, Dr. Garth Davis, in fact, was on the board of that obesity conference that kicked out Dr. McDougall.
My God, you gotta be kidding me. Did he really say that?
Yeah.
I think he said it earlier once too.
Yeah.
You gotta be kidding me. I was not on the board. I was very pissed off when they kicked McDougall out. I made a huge fuss. I called the chairperson of the committee, threw a fit, was really pissed off. Boy, of all the lies, that is the biggest, tallest lie in this whole thing.
Wow.
Yeah, that's all right, go ahead, Avi. Yeah, you've been quiet.
Yeah,
You've been talking this much.
Yeah, no. I've been taking it back. Well, wait till we get to the stat.
You're just waiting to unload the archive. Yeah. It's just chilling, just waiting. Okay.
Me. And watch.
Also, I love that picture of Garth too, making him look like it's like he thinks you're some kind of crazy friggin' apple-eating psychopath or something. Like, I don't know.
So it's very bizarre. But I mean, where does he come up with? I was on the committee that kicked McDougall out. That is absolutely bizarre.
It's funny because it sounds like not only is it false, it sounds like you like actively fought against it.
Actively fought against it. I was pissed off when they did it, and I threw a fit. I had a huge fight with the chairperson over it. McDougall and I had talked about it. I was flaming angry because all I ever do at these medical conferences is push plant-based diets, because they're very not plant-based oriented. And so I'm like the big I'm always at the front of the stage yelling about plant-based diets, and arguing with them over the research with keto. And for him to say that is, of all the stuff, I thought the 70% thing was bad. This may be the worst lie of them all.
Dr. McDougall, he told me. And you can watch the video I made about this.
Apparently.
Dr. McDougall.
Oh. Yeah. No, to be fair, it's possible that that's actually true, and it's McDougall who's confused, and he confused Jeff. That could be the case.
The conference, the purpose was to help educate other doctors on ways to make money treating obesity. That was the actual purpose of the conference. It was paid for by companies that sell obesity drugs and weight loss products. In 2013, the AMA designated obesity a disease. So if you watch my video, I showed the program for this obesity conference, and they had lots of courses on how to bill insurance companies, how to make obese patients repeat customers, how to use weight loss shakes, supplements, exercise machines, low-carb diets, bariatric surgery, etc. The conference objected to Dr. McDougall wanting to talk about 4 studies that showed a low-carb diet was harmful to heart health, thus not the ideal. Dr. McDougall has made his own video about this conference you can watch, but he was told it was a conference to teach different opinions, different options rather, that doctors could offer in their practices for obese patients. But it was not a conference to compare or criticize anyone else's approach. They didn't want Dr. McDougall comparing the plant-based diet to the keto diet because that could undermine other speakers at the conference who were pushing keto. You can watch my video on that, but my point is doctors like Dr. Belardo and Dr. Davis are involved in a very different kind of medicine than doctors using lifestyle medicine to get results.
Okay, that's it for him about you.
Yeah, and he's right about that conference. I was there specifically to fight those things. The conference, he's not completely right about the conference. It's not, it is that it does get funding from outside sources. Most conferences do, because you're just not going to put it on without those kind of things. But you know, a conference could be funded by companies, and then the companies have a room where they sell their products. But the actual science that's presented should have no bias whatsoever. But I don't like that group. It's called the Obesity Medicine Association, and I go there simply to argue for a plant-based diet.
So wait, is he's trying to like basically associate you with this group,
with that,
but really
with
the
that group,
nature,
right?
The nature of the association is actually a combative one.
Very combative.
Okay,
like,
so that's hugely misleading about his video.
It's hugely misleading. They hate me in that conference. They absolutely despise me. I get up in that conference, and you know, every keto paper that comes up there, I'm the first person at the front of the line to criticize it. So yeah, he couldn't be further off in that. I mean, it couldn't be further off.
I think we're gonna jump into even more of this. I don't know if you want to hang around for a bit or if you want to dip out.
I'm gonna have to get going. I got early cases. I got to go and help people at 6:30 in the morning. So
Hey, no worries.
I'm gonna hop off. But it's been good talking with you guys. I'm glad.
Yeah, good meeting you.
Hope people learn from it.
Yeah, thank you, thank you, Dr. Davis.
Yeah, it certainly added to have you here. Yeah, keep well. Bye bye.
All right, take care.
And
All right.
Now is the moment of truth. When he leaves the call, does it mess up the camera thing? We're gonna find out. Yeah, sorry. Where do you want to go now, Avi? I mean, I feel like
we're gonna go back to
here.
Here we go. Ooh, okay, so we're gonna go with where we're gonna leave off at 9.
Are inadequate.
Sorry, can you pause? Are we
said.
picking up where we left off before skipping ahead?
Before we skipped to.
Okay,
yeah,
cool,
yeah.
Awesome. Because people want to see us cover like the whole thing.
No, we're covering the whole thing. No, 100%.
Okay, all right.
As well as being expensive and even dangerous. In this recent video I spotlighted some of the strong research showing stents confer no benefits of any kind beyond.
So that's the Orbita trial. We'll get into that.
What a placebo gives, unless you happen to be in the middle of a heart attack. Otherwise, they're useless.
Okay, so he's pointing out the Orbita trial's finding, which is that percutaneous coronary intervention, unless someone, as he's quoting it, they're having a heart attack, showed no difference. So a couple of, compared to not placebo, compared to medical therapy. So it wasn't just the placebo controlled was the medical therapy group. It's not that they were just getting sugar pills, but in any case, so that's true. The Orbita trial did find that.
Do you want me on the Discord?
Oh no, it's not. This isn't not in the Discord. It's actually just on the screen, in the video. So it did not help with symptoms. The Orbita trial did show that. Of course, this trial also excluded certain subsets of patients with left main disease. And I'll just point out that the key here is that the majority of stents, the majority of percutaneous coronary interventions are actually in the situation that he's saying unless. They're actually in acute coronary syndrome in unstable patients, for example. And by that I mean STEMIs, so ST segment elevation myocardial infarction, non-ST segment elevation myocardial infarction, or NSTEMI, or unstable angina. And in those patients, it is beneficial, not just for symptoms, but for mortality. And over 80% of percutaneous coronary interventions are actually used for that. So the point that Jeff is trying to make is that stents don't actually make a difference unless you're in an unstable situation. But guess what? The overwhelming majority of stents are used in unstable situations. So he's saying, since in stable situations, stents don't help, stents are a con, stents are useless. That would be like saying, well, umbrellas are useless, they're a con because they don't keep you dry if it's not raining. So therefore umbrellas are useless. But the majority of times, where the overwhelming majority of cases where umbrellas are used are when it is raining.
Right, it's kind of like a worthless criticism. Like, it's not helping you to carry the umbrella if it's sunny out. It's like, okay, what when it's raining?
So in fact, let's actually go to the Discord. You can put that up.
All right.
Mm-hmm.
Okay, we are there.
And go to the Vegan Medical Lunatics channel.
we're already there. I didn't notice
category.
That.
Yep.
I didn't notice that category name. That's hilarious.
It's right up on the top, and scroll down to Jeff Nelson. We
are here. We're in the Nelson one.
All right, scroll up and let's go to stents. And do you see this? Do you see characteristics? This image that I have.
Data for stent replacement rates by context.
Yep.
You want me to bring that up?
Yep. Bring it up. Bring up that picture.
Okay, we can't see the side of the table. Hopefully that's okay. We can't see 2017.
Okay. It's the same. It's roughly the same percentage as 2016. But the point here is that if you look at the percutaneous coronary interventions, these are like the percentage that fall into given categories. And in 2017, in 2016, the one you can see, about 18.2% of percutaneous coronary interventions are in these.
Avi, I'm just going to turn your camera off for 2 seconds so you can just see.
Sure.
There.
Yeah.
You guys can all see that data there. You can just go back to that if you need to. Okay, sorry.
So you can see this trend over 2013 and 2017. The non-ACS presentation are those more stable cases, okay? And the ACS presentations, those are the unstable presentations. Those are people who are actually having some sort of heart attack or unstable angina. And in those cases, it's been effective. It's been shown to have a mortality benefit, not just the symptom benefit. And you can see over time, there's been this small shift. I mean, it's always been predominated by ACS presentation, but even more so as we go on throughout time. The non-ACS presentation, the more stable presentations, have taken up a lower percentage of percutaneous coronary interventions, and the ACS presentations have taken over a greater percentage of it. And it's true that the overwhelming majority of stents or percutaneous coronary interventions are used for the indication where it's been shown to be very effective.
Okay, I gotta ask a question or two. We're gonna do the idiot check here. So I don't understand exactly what I'm looking at. So I understand we have non-ACS and we have ACS. What's ACS stand for?
Acute coronary syndrome.
Okay, so so what is the overall point that you're making here?
So the overall point that I'm making is that the overwhelming majority of percutaneous coronary intervention. So that's someone intervenes by either putting in a stent or doing an angioplasty. Someone does a catheterization. The overwhelming majority of those procedures are done in the circumstance where it's helpful, which is the ACS circumstance.
What are these procedures referred to? What's the name for the category?
PCI or percutaneous coronary intervention.
Okay,
It's
so
that's the procedure that's done.
You're saying most PCI occurs
Mhm.
in the ACS context?
Yes. Yes.
Okay, and
The overwhelming majority, in fact.
and I don't understand exactly what I'm looking at with this data here. How do you see that it's a majority from looking at this?
Do you see the percentage, the brackets,
Yeah.
do you see 81.2?
81.2. Yeah, that I'll have to.
That's the
I'll have to
percent.
turn your
That's the
camera off so
percent
these
of
guys
total.
can see what's up.
Yeah, sure.
I don't see. I'm confused by that because 81
Okay.
and 18.2. Okay, those add
Yeah,
up to
yeah.
100. I see. Oh, and these
Yeah.
are subcategories of ACS down here: 19 and 25
Yeah.
and 30. Okay.
Correct.
So right. So this is a table of all this PCI intervention stuff, and we're looking presentation here. It's either ACS or non-ACS, and you're showing 81.2% occurs in the ACS context. So even if we were to grant that PCI is not useful in the non-ACS context, I don't know if you go that far, but even if we were to grant that, we would still say, well, 4 times that much occurs in the ACS context where it is useful.
Right.
Okay.
Exactly.
Also, I'll just mention it did change the camera, but it's manageable. It's like it shifted your box up a bit, but I'm sure people can manage it.
Oh, I can lower my head a little bit.
No, it's not going to help. It's fine.
Oh, okay. All right. Well, so that's the first point. The first point to make is that even if we were to grant that, it's still the case that the overwhelming majority of these procedures are done where it's clear that it helps.
I'm just going to make sure everyone completely sees this, right? So these are the years, right? Up here, 2013, 2014. N is the amount of people, presumably. So then, obviously, you've got their age. What's the saying? Female here? Is this just the percentage that are female?
Yeah, percentages that are female.
Yeah, by which you can infer the percentage male, obviously.
Yeah. Mm-hmm.
Right, so this is the total number, like 180 point... Oh, my mouse isn't on screen. Oh my god, you guys can't see what I'm pointing at. Okay, well, either way, you can... In fact, I could turn it on, actually. Here, one sec, I'll turn on the little capture thing. Properties, capture cursor. Done. Oh, it made the Discord go away. Properties, just let me... make it capture that. Discord done. Now does it show up? Oh, it's not working. Okay, well, I was going to try to make it easy for you guys to see. But anyway, so look, this is, you got the year, 2013, 2014, whatever, and then going down the column, right? Okay, you have their age, you have whether they're female, right? You have the presentation, and I guess that's divided into ACS and non-ACS, and then below you have subcategories of ACS. The number in the bracket is a percentage, right? So if you just look at ACS and you look at non-ACS, you can see virtually every year the ACS number is like around the 80 mark, right? 79.1 in 2013, 81 in 2014, 81.6 in 2015. And the non-ACS is, obviously it's ACS or non-ACS, P or not P, one or the other. So the non-ACS is just, the rest of the percentage. So the point here is that every year the majority of this, PCI is happening in the ACS context. And obvious further saying in the ACS context, it's shown to be clearly effective. And clarification, are you saying it's non-effective in the non-ACS context or just
not necessarily? It's certainly less. It's questionable in the non-ACS context where it's effective. There are several indications in the non-ACS context where it will be done. One indication is it depends where the diseased artery, what diseased artery we're talking about of the coronary arteries. If there's left main disease, that's definitely an indication. Of note, the studies that have, whether we're talking about the Ischemia trial or the Orbita trial, the studies that have shown no difference compared to medical management, they have excluded patients with left main disease. So that argument wouldn't apply to those patients. So left main disease would be one indication. Other potential indications are...
Sorry, left main, an indication, what do you mean by that? That's an indication of what?
Where it will be, where the guidelines say that it would be done.
Well, an indication that a non-ACS it would
Yes.
still be effective to do
Yes.
PCI in a non-ACS.
Where we think it will be effective, where it's thought to be effective in a non-ACS context.
Right. Okay. So you're So if you look at PCI in a non-ACS context just overall, you might get the impression it's not that effective, but then there's certain specific areas where
Yes.
it is.
Exactly. Yeah.
Okay.
Those specific areas, the big one to know is left main disease. There are two other ones to know. It's with diabetes and triple vessel disease, and the other one is with multivessel disease or triple vessel disease and decreased ejection fraction. In those patients, it's thought that non-ACS presentation may very well be beneficial. Even PCI may be beneficial even in non-ACS presentation. I'll just show you if we go to the Discord. I'll just show you.
We're still in there.
Okay, cool. Now, if you go to the AHA Journals link, AHA Journals, and click on it.
One sec. Oh yeah, right. Wait, there's two of those. The very first one, data showing in these contexts patients are helped with stents.
Yes, data showing. The one that says data showing in these contexts patients are helped with stents.
Okay, I'll open that up here. And let me just switch the scene over. Okay. So we're looking at that data now. We have it on screen.
Yeah. Now, I want you to go to figure 3. That's the meta-analytic summation for the unstable CAD.
Figure 3. Let's see. One second. Shown in figure 3. Okay. Impact of cardiovascular mortality. A summary of the results for the effect of PCI on cardiovascular mortality in CID is shown in figure 3. Okay. Figure 3 is up on the screen.
Okay, so what we can see, this is just to show that in the unstable context, that ACS context we were talking about before, that the percutaneous coronary interventions are helpful. And that's the meta-analytic summation for unstable CAD studies. So you can see the point estimate for the summation of unstable CAD for there are subgroups that are unrevascularized post-MI, multivessel disease following STEMI, and non-STEMI.
What are you looking at in this plot right now? What are you trying to
do you
draw
see the
attention
first subgroup, which is unstable CAD, unrevascularized?
Yeah, I see unstable CAD. Yep.
Okay. Then you see unstable CAD multivessel disease following STEMI.
Yep. Mm-hmm.
And then you see unstable CAD NSTEACS, which is non-ST segment elevation acute coronary syndrome. So if you summate all of those studies, what you get is a point estimate of 0.69 with a confidence interval of 0.53 to 0.90.
Wait, if you summate all of them.
Yes.
Oh, right. All of the unstable. Right. Yeah. Right here.
Yeah.
Okay. Yeah. And that's significant. You can see it's here. Maybe I can zoom in for people. Is there a way to do that? Yeah. Here we go. You guys like that zoom? Oh, can I not scroll down? I spoke too soon. Got too cocky about the zoom. Anyway, this is. Am I looking at the right one? Right here. This is the one. Focus on that little diamond. Okay, that's as close as we can get. You see the gap between that and the dotted line. I'm just showing it for people on the screen. Yeah.
So we do see a statistically significant improvement in mortality outcomes, not just symptoms, but mortality outcomes in unstable presentations.
Yep.
When percutaneous coronary interventions are done.
And that's I guess, so one of the things I've learned in stats is that statistical significance and clinical significance are different. So the first a statistician can find, right? And it's, it's obvious it's significant. Unless you're Destiny. Sorry, I couldn't help it. I'm sorry, I couldn't help it. But because this is actually an instance of the same kind of thing, right? You can see the confidence interval there doesn't overlap with 1, right? 0.53 to 0.90. But yeah, what was I about to say about this? Clinical
significance?
Exactly, yeah. So then, but when it comes to clinical significance, you have to actually ask the experts in the field. So what would you say about clinical significance here in addition to statistical significance?
I would say it's remarkable to show an intervention that for unstable patients that have a 31% decrease in mortality. I think that's great.
I'll let you continue on, but yeah, we've got a clear visual on all this for everyone.
Especially considering how many people die from this disease, like the total amount of people. Yeah. Okay. Cool. So we can go back to the video.
Okay. Well, I don't think I actually need to switch a scene to do that this time. It is just behind this. You can play it whenever.
And bypass angioplasty also conferred no benefits in a large randomized controlled trial of 5,000 people. No other studies have looked at this like the
Same response, by the way. So one intervention, angioplasty being part of the percutaneous coronary interventions, the overwhelming majority of them are beneficial, and there are some indications for bypass even in the non-ACS presentation. So the fact that he's pulling up a paper that showed, oh, overall, if you just look at stable coronary disease, percutaneous coronary intervention didn't make a difference. Again, same response.
So
like it's just a mind-numbingly stupid thing to bring up.
Now I understand the broader thing you're saying, because I can just think about the categories. But so obviously you're saying, look, there's stable, there's unstable. The most efficacy is in the unstable context. In the stable context, there's certain areas of efficacy, but it's obviously not as effective overall. So you're sitting here, you're going, there's these two things. This one really effective. This one only in specific areas. He's just looking at that one and he's going, oh well, it's not doing that much overall. And then I had a question about what we're talking about, because I'm just thinking about it as I just have categories and labels in my head. I don't know what all these things necessarily are. So PCI is stent is a kind of
it's a kind of PCI. It's kind of percutaneous coronary intervention. So you're doing a cath and you're actually deploying a stent.
Right. Okay. But the bottom fucking line here is just he's saying he's criticizing it's the umbrella thing, right? He's saying it's like a high percentage of the time umbrellas don't do anything out in the sunlight. It's like, yeah, if someone can grant that, but that doesn't show that overall umbrellas aren't a useful tool, right? Because you're just ignoring the context where they're highly effective.
Right. Exactly.
These researchers did. Bypass and angioplasty, they don't make you live longer or confer any other benefit. So it's
in the majority of contexts where percutaneous coronary interventions are done, they absolutely improve mortality, including angioplasty was part of that data. And yes, bypass is indicated as for the indications I've given already. So
a con, the best
not a con
research that's out there. You can watch my video if you want the details on those studies.
Look at this. Look at this thumbnail. Our cardiologist scammers just pulling out the wallet of like what.
I'm also putting a link below to a study of statins that shows that for each year of statin use, you gain 1 extra day of life compared to someone taking a placebo. This is the study from the BM.
All right, so this is a super dishonest move, and we're going to go through this. Okay, so let's look at the study that Jeff cites, and it's in the Discord.
We are in the Discord.
Yep. Okay. It's probably best to view this in PDF format. I don't know if you can put that in the on screen or whatnot.
Yeah, no, I can. It's not linked in here though, is it?
No, but it's a PDF on the top. If you scroll up, there's a PDF like in the top left corner of the page. If not, I can just send it to you.
PDF in the top left. What are you talking about here? I bet people see it on screen and they're laughing at me. What do you mean top left corner?
Here, you say PDF. Like, do you see like if you scroll
up? Sorry, yeah. No, never mind. I still don't see. Sorry, I'm an idiot. What are you talking about?
I can just DM it to you. It's fine.
Well, I don't want to open our DMs on screen. Just post it in Jeff Nelson and then delete it.
All right, cool. Yeah, I'll just post it in in Jeff Nelson. So here is the study.
Okay, I've got that open. You can delete that.
Cool.
All right, and then I can bring that up on stream. Nothing else we need from the Discord. You want to just go over to that study?
Oh, there'll be we'll go over that study and there'll be more from the Discord. But so I just want you to go to table 1.
Sorry, I'm having a little problem here bringing this up. You got to give me a second.
Sure.
Let's see. Oh, I see. Here we go. Yeah. Okay, I've got it up. Okay. Sorry, you want me on the study right now, right?
Table 1.
Okay, let's go over to the study. Here we go. And let's find that table 1. Where's table 1 at? Hey, table 1. Okay. Again, little hard to see. I need to work on our camera placement, but yeah, let's I'm just gonna temporarily turn your camera off if you talk about a part that's covered. But yeah, let's walk through this.
So what this paper is basically they took different statin trials and they looked at postponement days. They calculated postponement days, and that is how many days did this intervention postpone death, essentially. That's what they were trying to look at. They took the Kaplan-Meier curves of each of these trials, and they compared them to the placebo, and they used that to see if there was a difference in postponement days. And they listed the difference in postponement days. Now, you see that all that information on this table. You see which trial it was, the number included. You see the cut point in years. So you can take the postponement days divided by the years that they were on the medication, and you can get the number of days added per year that you're on this medication. Sounds simple enough. Okay. Couple of things with this study. So it does actually show, and I actually ran the meta-analytic summation of the difference myself. That's in the Discord as well.
All right, let me know if you want to bring that up.
Yeah, you can bring it up.
Okay, I'm just going over to this. Is there anything else we need to do with this table in the meantime?
No. We'll just keep it handy in a safe place.
It's sitting around there. All right, and then you did a meta-analytic summation. Oh yeah, I see this here.
Yep.
All right, I've got that up.
Experimental compared the difference of the postponed days from the experimental compared standardized to the control. And yes, so based on per year that they're on the medication. And yes, it shows about 1.5 years per year that they're on the medication. So looks like Jeff is right, except a couple of things. So number 1, if you go back to the table that you had before, the all-hat LLT study, you'll notice that
wait, you lost me. The table we were just looking at?
Yeah, the table 1.
Okay,
yeah.
We're going back to that.
So you notice literally the first study, the all-hat LLT? Notice how the point estimate of the relative risk is below 1, and yet the postponement days are negative?
Yeah.
So if you actually look at the at that individual study, if you look at those Kaplan-Meier curves, you may want, so already you should like have a little bit of a red flag here, because you should ask yourself, well, wait a minute, how is the relative risk below reference for death? But at the same time, even if it's not statistically significant, how is the relative risk at reference for death below 1?
Right, but they're dying sooner.
They're dying sooner,
right?
Let me send you the link. I'll post the link in the bottom of the Jeff Nelson segment. Here's a link to the actual study. So here's the actual individual study.
I've got that open.
Yep. Go to figure 3, Kaplan-Meier curves for all-cause mortality. And try to zoom in as much as you can to get like the best view that you can.
I miss? I must have missed it. 1 second. Figure 3.
Figure 3. Go to figures and tables. Like at the, you see there's contents, references, figures and tables.
Wait, no, I don't.
So,
should I? Wait, am I not in the right thing?
Are you in the paper that says major outcomes in moderately hypercholesterolemic hypertension?
Yeah, I'm at methods, follow-up, treatment, sample size, outcomes, results.
Maybe you could just download. If you download the PDF, you see where it says download PDF on the
Yeah,
top of it?
that's fine.
above the
I have to
original
sign
copy?
in to do that though.
Okay, never mind. Don't do it. Then go to the right hand side more. Do you see more right hand? And it says
Oh yeah, I
content,
see it. I see it. I
figures,
see it. I
tables?
see
Yeah.
it. I got
Okay,
it.
cool.
Okay, what table did you want here?
Figure 3.
Okay. Yep. Figure 3. Oh,
Mhm.
that's small. Wish there was a way to make that a little
Yeah,
bigger.
zoom in.
Yeah, it's a little hard to see, but
Yep.
all right. Yeah, I got it. People can see it. Yeah.
Okay. Do you see where it says all cause mortality?
It's a little hard to see. Let me just. Oh yeah, all cause mortality. It's right there.
Yeah.
Mhm.
So you'll notice that actually the statin group. Do you see how the statin group for the majority of the statin group is that little slightly more dotted line, the pravastatin
Oh,
group?
it is so
It's
friggin'
so
hard
hard.
to see,
I know. I
Avi.
can.
There's
Yeah, I
I
know.
can't tell
It's
which line is
terrible.
which.
Okay, you'll have to take my word for it then. But what I can tell you is that, and anyone who can check this out can look at this as well. But the more dotted line is the statin group, and the solid line is the usual care group. Now you'll notice that one line for the overwhelming majority of the situation is slightly earlier in this Kaplan-Meier curve than the other.
Earlier, you mean higher?
Higher. Well, yeah. I mean, sorry, I shouldn't say earlier. I should say higher. So except at the end, you actually by the end of it, you actually see that it's slightly lower.
Right. Yeah, I can see that.
You can see it crosses. So what I want to bring to the table is like where you're measuring the Kaplan-Meier curve actually matters in terms of your postponement days, because they didn't calculate the postponement days from the relative risks. The relative risk came out to be ever so slightly, the point estimate being 0.99. But what they did is they just measured some difference in the Kaplan-Meier curve. And I'll actually quote it from the paper. So in brief, from this, we magnified the Kaplan-Meier graphs from the publications by 300%.
Oh,
and
sorry.
And imported them.
This got fucked. How the fuck did Joey's camera box get turned on? What in the actual fuck? Wow. Sorry about that.
So just to show you what they did. In brief, what they did is they took the Kaplan-Meier graphs in the publication, magnified them by 300%, put them into Microsoft Paint, Microsoft Windows version 7.
Oh, amazing.
And then they drew this like line, this pixel line. They used this, the latest time point, both survival curves were drawn in the original Kaplan-Meier plot. If more than what cut point was used in the original publication, we chose the latest. And they just calculated this like difference with some like they counted using a polygonal lasso tool. So they calculate the area in segments with better survival and untreated as negative, and they use the cut point to the right of the border given the area between the survival curves. So where you draw this cut point in the Kaplan-Meier curve actually matters. It's a terrible way of doing it. You really should be doing have some way of doing it based on the first of all, before we get into that, do you appreciate how where you draw the cut point you can actually get a different result in the postponement days?
No, I don't. Is the idea
Okay.
what is it? I don't even know what it means to draw a cut point in that context. Like where yeah.
Okay, so if we so let's say like this. Let's say I just take a look at the middle of this graph, right, in all-cause mortality.
Yeah.
You'll see that at this point, it looks like one group has a worse mortality.
Oh,
than the other group.
you mean if you take a snapshot at any one given point? Yeah, sure, of course.
Yeah.
There's points where it'll look like one's higher than the other, sure.
And
oh, are you
other
saying they
points
just
where it
took a
looks
snapshot of that little end
Yeah.
bit where it over? Oh, wow, that's hilarious.
They
Okay.
took a snapshot of one point.
Now I don't know
where
what
if
the
you-
right methodology is, but surely it's got
Right.
it's something like maybe it's looking at area under the line, or maybe it's looking at on average
Right.
like how big the difference is between
Right,
the
you
lines
can't
and what
just-
position. It's not a snapshot.
Yeah. if you just take a snapshot, you can actually get the inverse results if you
So
take a
s-
snapshot at a different part of the
Did you
the
just
Kaplan-Meier
get
curve.
tipped off to that because you looked at the RR and then you looked at the postponement and you're like,
Yeah.
wait, what the fuck?
Yeah.
and then you found this. That's funny.
Yep.
I like that. Yeah,
Yeah.
that's
So
good.
that's number one. They've also they've actually studies that had the point estimate.
Mhm.
This analysis has studies at a point estimate benefiting the statin for mortality, and yet their postponement days are negative. They're saying the statin decreased lifespan
Okay,
because of the way they chose the snapshot in the Kaplan-Meier curve.
okay, I want to go back to that table with postponement days, so because I
Yeah.
remember kind of what it showed, but I think it'll be useful for people to see it. Or was it this one or one of the other ones? That's Jeff Nelson's crazy shit. This is AHA journals. Maybe it was on that tab that I was in. Where was that? Nope. Oh yeah, right here. Oh yeah, here we go. Okay,
Yeah.
so yeah, right. So all hat LLT, yeah, so the relative risk is below 1, less than 1, right? So you would expect someone at lower risk to have an extension of life, right?
Right.
That risk is lower than 1. Although, wait, the confidence interval overlaps 1, so it wasn't significant then.
Yes, but you would still. But what I would expect
yeah,
then is
sure.
that the postponement days point estimate should be positive, and maybe it wouldn't be
Right.
significant. That's fine, but I wouldn't expect it to be negative, especially not
Right.
-5 days.
So you guys all got to see what Avi did here. So he looks at this number. He's like, okay, less than 1. So the postponement days should be, a positive number. He looks over here, sees this negative number. He's like, what the fuck? So he goes over to this study. He goes and looks at this table, and he finds that they took a snapshot of this little end point of these two lines, where it turns out that the one line is a little higher than the other, but really, like, you can kind of tell on average overall the opposite is the case, right? So it's a very strange measure that they took, and he got just tipped off to that by this
I don't know
RR
where.
being below
I don't
1
know.
and this being
and just to be
negative.
clear, like, I don't know. I don't know how. The point is, it matters where you do the cut point, and I don't know how they're. I just don't know how they're getting a postponement date of 5 days. Which is comparable to other studies in the opposite direction that have like these relative risks that are far improved.
Well, wait, I thought we were
With
saying.
a point, yeah.
Oh, sorry, no, go ahead.
No, I can see how they did it. It makes a difference based on where you choose the cut point in your Kaplan-Meier curve.
And do you know they took it from this last little bit here?
Well, based on the way they describe it, they use. I mean, here's the method. We can look at their paper. It says here there are a number of technical caveats as well. So if you scroll page down,
You want where, down to methods? You got to tell me what to look for in this.
after table 1, you see the next page.
What do you mean? Are you talking about in figures and
Scroll
tables?
down.
I don't know I don't know which
The
you're
next
wanting me
page.
to.
So page.
Wait, I don't know what. Sorry, I don't know.
Scroll down to page 4.
1 second, Avi. I don't know what you're talking about right now. Are you talking about the major outcomes in moderate as this study right here?
Oh, I'm talking about the effect of statins on average survival in randomized trials.
1 second. Where's
In
that?
analysis.
Was
That's
that
the one where you
was
had the
that
table.
this one? Yes, right. Okay. All right.
Yeah.
I'm on it, and
Just
sorry, I didn't register all their names.
Yeah.
Page 4. Wait, where's the fuck's the page number? What the fuck?
It's the page after the table.
Oh, okay. Right. We're on the page after the
Okay.
table.
Do you see the second paragraph?
There are a number of technical caveats.
Yep.
Yeah.
There are a number of technical caveats. The method used to estimate the area between the Kaplan-Meier curves may seem too technical for routine use. However, it was reassuring to see that the quick method produced nearly identical results. None of the quick method estimates deviated more than 5 days from the pixel count estimates, and most deviations were below 1 day. Also, in a technical note, the SEs provided in this paper refer to the area calculations alone and not to the overall effect of the intervention. For example, a single underpowered study is likely to have a hazard ratio in which the confidence interval crosses the null value. That intervention is that intervention is harmful cannot be ruled out from the study alone. Yet the survival curves may show good separation, and the area between the curves may be calculated with little uncertainty. Unfortunately, a statistical model has not yet been developed that incorporates the uncertainty of the net benefit of the drug, such as the confidence interval or the HR, into the postponement model. Consequently, there are currently no methods to meta-analyses of outcome postponement. Before that, they say, one moment. Actually, go to analyses. Scroll up above. I'm sorry, my bad. That was the wrong.
No, it's fine.
Yeah, go to analysis.
Yep.
So
yeah, I'm there.
Technical area calculations are shown in the online summary appendix B, and briefly magnified the Kaplan-Meier graphs from the publications by 300% and imported them into pink. 10 of the 11 publications were available in electronically processed format. The last was available in a scanned copy. A vertical line was drawn in the cut point according to the original publication. A reference area was drawn in the lower left corner of the graph using the tick marks of the X and Y axis in the original graph. The number of pixels in the reference area was calculated by multiplying the measured number of pixels at the length and height of the drawn box. The graph was then imported into Adobe Photoshop, and the number of pixels between the survival curves was counted using the polygon lasso tool. We counted the area in segments with better survival in the untreated group as negative.
Oh, man, I remember you saying polygonal lasso, and I was like, "What? I do know what that is. It's the tool." And okay, yeah, all right.
Yep.
I use that. That's how I crop people out. Okay.
Right. And we use the cut point as the right border of the area between survival curves. If no cut point was given, we use the latest time both survival curves were drawn in the original Kaplan-Meier plot. If more than one cut point was used in the original publication, we choose the latest. All calculations were carried out in triplicate by 3 independent observers to assess variance within area calculations. Okay, so the point is there's going to be, this method can give you a discrepancy between the standard methods of reporting risk of mortality and this new method that they're doing, which has not been validated.
Mm-hmm.
Their own paper mentions, there's no accepted way of doing these postponement days meta-analysis.
Mm-hmm.
And you do get discordant results. So that's just one thing that should tip you off. Another issue, another thing I'll bring up is that in these trials that are being summated, a substantial portion of the control group ended up being treated with cholesterol lowering medication. So there was crossover. So you're not just comparing statins to placebo anymore. You're actually comparing statins to placebo and some placebos that crossed over to cholesterol lowering medication. Thirdly, this meta-analysis excludes statin trials with larger than the mean here for postponement days, such as HPS, LIPS, etc. So there are some trials that are curiously excluded without mention for why. Fourth, it doesn't consider that postponement is a cumulative average and not what life expectancy increase will be for people who do benefit. The reality is that this increase is not spread even. 93% of people will see no benefit in lifespan, but 7% of people will see an average of 99 months of extra life. For example.
Oh, wait, are you saying that? So there's a lot of people, and there's a small amount of them that get a big improvement, but we're looking at, we look at like if we distribute that improvement out across all of them, what does it turn out to be?
Yes.
Oh, this is just so like, and it's just stupid when people do shit like this. So maybe people could use an analogy here if that's not obvious.
I'll give them an analogy. Let's take wearing a seatbelt, right, when you're in a car, right? If you looked at how much that prolongs your life on average, it's actually not going to be that much. And the reason for that is because most people don't die from a car crash. Most people end up dying from something else other than a car crash. So if you wore your seatbelt, most people actually see zero benefit in terms of mortality. That doesn't mean that seatbelts aren't very valuable, because for the people that do get into life-threatening car crashes, they do see benefit, and they see a great deal of benefit.
Right. You wouldn't want to do something like take the days of life added to, by the individual saved by seatbelts, and then divide those days by the total amount of people wearing seatbelts, and say the average person gains like 10 seconds of life by wearing a seatbelt. So just fuck wearing seatbelts, right? It's just incredibly retarded.
It's just
Yeah,
that's literally the point that's made. Yep. That's, in fact, if you go to my Discord, I have like there's an image explaining that.
Let's go. You were ready with that analogy, eh?
Yeah.
Okay. What am I?
I mean, you could do
here?
it for many things. You could do it for wearing a helmet if you're on a motorcycle, or like all sorts. There's so many.
Yeah,
things
you could do it with the umbrella, right? Total amount of water display. Well, actually, most people are using
you could do it with
in the
vaccines,
rain, so it wouldn't work.
You can do it, yeah. Although actually, I shouldn't do it with vaccines because Jeff is presumably against vaccines anyway.
Well, what do you want me to open here? You want this 3-dimensional graph?
You see the 3-dimensional graph?
Yeah, it's up. Let's go. The only thing they can't see is the little side here, but this says 7% of patients gain an average. 7% of patients gain an average of 99 months. 93%.
Yeah.
Oh, we don't even need you here. I can tell what your graph says, right? 93% of patients gain no increase in lifespan. What are the dimensions here? So this is over here is lifespan is the upward direction, and I'm having trouble understanding how they modeled this here.
It's really just imagine each square. See each little square. It's just laying out a bunch of people.
Oh, okay.
It's laying out like a group of people. Like each square represents a group of people.
Right. Okay. So like you can look at each little square in here like group people. So right, it's you look at this and you're seeing most of this shit is flat, right? It's like 93% of these people gain literally nothing in lifespan, right?
Yeah.
And then 7% get this like huge increase, and you can tell some people here are getting increased, but obviously the whole point here is just that there is this huge effect, but it's not distributed evenly across the population, right? So if you were to take all of this green area and then distribute it over the flat area, you're like, oh, there's barely any difference made. It would raise the flat area by like a day, right? It's like, well, but that's not how it's distributed. And to ignore that is just to be retarded and tell people not to wear seatbelts.
Yep, exactly. That's the key point, and why people are so remarkably stupid when they say things like statins barely prolong lifespan. It's just, you could say the same thing for seatbelts if by that kind of logic.
Right. So this is just insanity.
Yeah. Yep.
What you want now?
On top of all the other problems. Yeah, we'll continue the video.
Okay, that is gonna take me a second. Let's go back. Oops. Okay, yeah, we are there. Go ahead.
MJ, British Medical Journal, which was done by a researcher who is often hired by the statin industry, who looked at studies that were
It's just irrelevant.
He just always throws shade. Yeah.
all paid for by
I wish
the
he'd
statin industry.
criticized. Have you ever heard Nelson make a single methodological criticism as opposed to this bullshit like X is a shill or X is paid by whatever? Or...
I've heard him try to make methodological criticisms, but he didn't end up knowing what he was talking about. I've never heard him make a successful one.
Yeah, like it's so funny because I forget that like there's lots of people who are probably watching this and who like I forget what it's like watching it for the average person because I like experience so much insane bullshit constantly from like doing this kind of stuff online. But I guess the average person might not be sensitive to just how bullshit his whole like mode of talking is. Like there should be certain like dead giveaways. Like Jeff has not talked about methodology at all here, right? He's cited one or two studies to try to just draw claims from them, which turn out being like taken out of context or sketchy or whatever. But there's not any like you should just notice the percentage of what he's saying that is just like character attacks, like calling people shills, questioning like funding sources, or blah blah blah, so on and so forth, right? Like, you should notice the distinction between that and how Avi approaches it, which is just to look at the data and just see what the data says, and just transparently show the actual data on the screen and just explain what it says, right? What do you think is more reliable? So just drawing a little attention to that.
So bias, it would have been in the favor of statins, but you can freeze and read the conclusion. It found that for each year of statin use, you gained only one extra.
At best, he points to a quote from a study or a conclusion or abstract or something like that. You're never gonna see Jeff actually look at like the methodology of the like. You wouldn't be okay.
Day of life. This was looking at statin use in people following the guideline-directed therapy, and what a disappointment to see that they only got one extra day of life for an entire year.
That's hilarious. So I feel like compelled to switch back to the Discord because it's nice that this is so visual because people can just see how full of shit he is, right? He's sitting here saying, you know, whatever it was, 90-something% of people get no benefit, but this is what he's talking about, right? There's this huge benefit that's distributed to a small amount of people, right? It's like, it would be stupid to say, on average, people are getting like, you know, a day or something of life because it's not distributed evenly like that, right? If it were, then I doubt Avi would be making the case for, you know, with statins, right? Just be like, yeah, I mean, it'll give you a day of life. Like, fuck it, who cares? Probably not worth taking a pill every day, right? It's just so, like, I mean, I just can't emphasize it enough. It's like, it's just so stupid to say you're gaining an extra day of life when it's like most people get nothing. Some people get this huge benefit. You may as well, again, seatbelts are like the perfect analogy. I love that you mentioned that because it's just like, you may as well be telling people not to wear seatbelts. Like, I wonder what the numbers actually are. Like, think of the percentage of cars that like crash of the cars that are driven in a day, right? It's like some extreme minority. If you calculate it, people are probably not gaining that much life by like wearing a seatbelt, right? But
yeah,
you know, those who get in a crash, like, I mean, there's a lot of people who really benefit from it. Yeah, so this is just insanely stupid. Jeff has utterly no idea what the fuck he's talking about. I'm back in the video now. I just had to show the graph again.
Yeah.
And this was comparing them to people taking a placebo.
Like, I just can't stop. I'm sorry. It's so crazy because he's sitting here. He's literally telling people statins are useless. And if you're one of the people in one of those in the green area of the graph, you're getting like severely life-damaging pseudoscience given to you right now, right?
Absolutely.
Right.
These treatments, angioplasties, bypass surgery, and so on, they're called guideline-directed therapy, and they're very profitable for the doctor and the hospitals and so on. Invasive cardiologists get paid a lot of money starting in their first year of business, $648,000. So of course they spend a lot of money to get there, but where do
wait, pause. I thought derm, we have to debate now. I thought derm was the highest paying area. What the fuck happened to that?
Derm's not the derm is not the highest paying one. It's the best work to pay ratio, I'll tell you that.
Oh,
now I don't.
okay.
One thing I don't know if his invasive cardiology numbers are accurate. I'll just say that. They could be. I don't know if they are, or if they're well representative. I haven't checked the invasive cardiology numbers, but even if they are, so what?
It's just so insane. He's just sitting here. He's just made this false claim. He's like, you know, their statins fucking do nothing when in fact they do. It's just you're just doing a really stupid kind of statistical error when you say that. And now he thinks right now, he thinks that he's discredited them, and then he's going on to talk about like the uselessness of cardiology. But it's like once you take that kind of, I don't know what to call it, like round out from under him by just showing that his statin point is wrong, it's like now he's just riffing on cardiology being bad without any reasoning at all behind it, right? Yeah, okay.
Guideline-directed therapies from conventional medicine, where do they come from? They generally come from
I need to like post this graph at him. Oh, he blocked me. All right. I can't. I literally was about to be like, guys, we're going on Twitter, but he's blocked me. But I honestly, in a non-harassy way, do not harass Jeff Nelson. He is promoting dangerous pseudoscience. So if you want to, you know, make him aware that his claim about statins is false by just making the car driving analogy, because even an idiot can fucking grasp that, and just posting that graph, Avi's Discord is linked below, that would probably be a good thing. Maybe you should become aware of the debunk, right?
Yep.
Don't harass him
With-
though.
People who get paid a lot of money by the drug industry. For example, here's a top cardiologist who's got a lot of
I love
Oh.
the random riff on Charles Michael Gibson. He's so salty that Charles Michael
Right.
Gibson is not convinced of Ornish's.
They need the context here. For anyone who's not aware, I mean, basically, this is like, Avi, explain like who this guy is and what your interaction with him is, and it'll be obvious why Jeff hates him.
Yeah, so he's a leading pioneer in quantitative coronary angiography. He's a well-known, well-respected cardiologist. He is from Harvard. He has numerous publications in the field. And when I was running my Ornish analysis to cardiologists, he was one of the main people I went to as a check to see if what I was saying made sense.
And I'll point out, I'll throw one in here. Avi was hyped to talk to this guy, right? He's like, I'm talking to C. Michael Gibson today. This is going to be a good one. If anyone's going to point out an error, it's going to be this guy. That was the attitude going in.
Yeah, just to see if there's any mistakes I'm making, to see if anyone could point any holes. And I ran my argument by him, and he not only did he agree with what I was saying, he actually added more. He gave me more to my argument.
Right. And what was the bit that he added on?
The bit he added on was like, he gave me actual photos of some of the things I was talking about, like pseudo regression. He added a whole bunch of stuff on that. A lot of
right. And didn't he pioneer what is it?
Quantitative coronary
QCA.
angiography. He pioneered
so this guy pioneered. He pioneered the method that's used by these pseudoscientists like Ornish.
He pioneered methods to make quantitative coronary angiography more accurate.
But did he pioneered the actual method itself in the first place, though, right? Or did he just pioneer?
I'm not sure if he pioneered the technology, but he worked with the technology for like God knows how long, and he pioneered methods to advance quantitative coronary angiography and make it more accurate.
Right. Okay. So it's like, this guy's done tons of work on the method that these pseudoscientists use to promote their crazy claims, like that veganism has been shown to reverse CID. But yet it's like, oh, he's hated because it turns out this guy who's done all this fucking work in this area, well, he actually disagrees with some of the shit that people are saying based on the technology he's done so much work on. I'll throw him under the bus. He's a shill, cardiologist, shill, whatever. It's like fucking lunacy.
of influence.
I'd love to see Nelson try to hold his ground in a conversation with this dude about like any of these topics. It'd be hilarious.
Not a chance.
Dr. Belardo and many other cardiologists follow. Charles Gibson, he's at Harvard and has a huge reach. If you look up Dr. Gibson in this database on ProPublica, this shows money the pharmaceutical and medical businesses give to doctors. You can see that in 2018, Dr. Gibson got $355,000 from drugs.
Yeah, it's just like, who cares?
Yeah, if his claims are wrong, show us the data, Jeff, you fucking brain dead idiot. I don't care who's paid by who, right? It's like, if they're wrong, show us data, right? And the attempt you made to show data, sorry, Avi, we're doing it again, kind of backfired in your fucking face with a graph that makes you look like a fucking retarded person, okay? This is what happened when you tried to use data, okay? Maybe you should stick to the character attacks, you fucking brain dead idiot, because yeah, the data thing, it didn't work out too well, did it? I'm going back. We can.
Drug companies, all detailed and broken down, speaking fees, consulting fees. Also, his wife is involved in the drug industry, and she's
who cares?
Drug wife.
Getting money according to disclosures. But this is the conventional medicine system. Influencers,
he thinks that's a point. He thinks that, like, he thinks he's discrediting this guy by showing that he got money from pharma. It's like, you didn't show that a single logic, philosophy, whatever, but you didn't show a single proposition this guy's actually on record assigning a truth value to has a different truth value, right? That's what you are supposed to be doing here if you're going to say he's wrong, right? You're just attacking his character. It's like level 0, like, logical fallacies. Like, Jeff Nelson, although he tries to present like professional, whatever, he's got his suit, tries to talk politely, seems like high society. It's like, what he's actually doing is he's just character attacking, and to the extent that he provides data, he's face planting. And he's running from debate. And even
or
discussion.
YouTubers, they get paid to push products. And this kind of medicine can be really, money driven. Now, another plant-based conventional medicine doctor giving advice on social media is Dr. Garth.
Okay.
So we're going to skip this because we went over it.
Let's do it again
already.
no, just kidding.
All right. That's all right. Okay. So here we go.
There's an Avi tweet.
Nip at the heels of people who are actually very accomplished. This is are involved in a very different kind of medicine than doctors using lifestyle medicine to get results. Dr. Avi is another plant-based doctor who practices conventional medicine.
Look at that attempted crop. Can we just notice the bad crop?
Let's see. Hold on. Oh, yeah.
Come
like
on.
part of there's like an angle over here. Yeah.
Come on.
He's a doctor who loves to debate. Everyone has a hobby, I guess. Maybe he went to debate camp growing up and that's his thing.
No, I just love to debate.
Yeah, debate's kind of a good way to get to the truth. Maybe he has values like finding out what's true. And you can mock debate all you want. We've already wrecked your points on that, right? If the idea is debate's not a productive way to get to the truth, that depends on the intent of the people participating in the debate. Avi's intent is to reach the truth. So the only argument for debate not leading to truth in the context of you versus Avi is your own intentions not being to get to the truth. So that's a fucking faceplant right there. And then there's the fallback point of even if we grant it, we say, fine, debate's bad. Why not have a discussion, right? If you're going to criticize someone publicly on your platform, at least give them the chance to fight back. But you won't because you'd get destroyed. So, just keep talking shit in the shadows and we will keep wrecking you in these videos. We're happy to add to the Jeff Nelson Destroyed playlist.
Essence spend time, doing studies, helping people get off drugs and become much healthier. Dr. Avi spends his time on social media making debate videos. I think challenging lots of other doctors.
All right, you need to stand up for. Even I don't know if Avi's gonna fucking say it or not, but just talk about what you actually do.
Yeah, so what I primarily do with my time is research. I've been doing research for years now. I'm doing research in dermatology. It's with multiple investigational therapies for psoriasis, atopic dermatitis, alopecia, vitiligo, and these are the severest presentations. Like we're not talking about a little bit of psoriasis or eczema. We're talking about like head to toe patients where I'm doing several biologic injections or oral systemics. We're also doing topical medications. And then in the works we actually do have a randomized controlled trial for dairy and acne that we're going to be looking into to see if because no one's actually done a study with a randomized controlled trial with dairy and acne. There's only been observational data, so we want to see if that actually is we can finally say that actually the observational data is correct or incorrect, whatever the truth comes out to be. So the majority of my time is not spent doing debate videos. The majority of my time is spent actually just working in the field of research.
Yeah, like it's insane what he's saying here. It's like Avi spends so much, like he's spending his time doing research that will have, like meaningful impacts in people's lives, right? It's like this is going to help us with our understanding of, health conditions that really affect people, right? And I mean, guys, best friend, talk to him fucking all the time. What do you think he's doing most of the time? He's at work. He works constantly, right? It's like we're all lucky that, apparently at the end of the day, Avi still has the time to, hop on social media and debunk some bullshit or do streams like this. Like that, I mean, that's just I guess he finds it enjoyable, right? That's just lucky for all of us. But the thought that this is what Avi does is insane. This is like a side thing. It doesn't even take up a fraction of the amount of time that your actual work in medicine does.
It's my hobby. It's a hobby.
Yeah. And also trivializing it like debate, blah, blah. It's like, I mean, those debates, it's like he's just trying to paint you like, oh, he's just some debate bro, just wants to win, like, blah, blah. I hate this perspective, right? It's like, your debates have shown that a ton of people are completely full of shit. They've shown the reality behind a ton of information, right? Those debates, for people who are actually seeking truth, not trying to, delusionally preserve their ideology, are hugely useful, right? The people who come back to this channel and watch your content Like they're finding value in the kind of, medical analyses you're doing. You're not sitting there talking at a layman level. You're going into complicated medical. So it's like, yeah, I guess just the point is it's a really crazy bullshit way to try to characterize you. You're doing doctor work most of your time. And yeah, I don't remember what else I was going to say. Let's continue.
To allows him perhaps to try to, nip at the heels of people who are actually very accomplished and high profile.
See, this is so funny, right? Because this is speaking to your. I guess maybe I should let you talk, but it's like he's trying to say like your motives are you're just clawing for any bit of attention. It's like, look, if you wanted attention, you can get it. He knows Richard. He can go on his channel whenever he wants, right? He doesn't unless he feels like wrecking Mike or something. It's like. The idea, it's just, here's the bottom line, okay? He's reading Avi's fucking mind. He doesn't know what's in Avi's mind. He doesn't know if Avi's just clout chasing, nipping at the heels of people. And I can tell you, right, with fucking Ornish, I was there seeing those DMs, conversations with Esselson, Ornish and stuff without revealing anything. It's like, Avi was willing to talk to them in public. He didn't even, or private. He didn't even care if it goes public or not. It's like, he's happy to just try to spread the truth, even if he never gets credit for it. He's not going to sit here and say this because he don't want to toot his own horn, but all of these things are true, okay? So the thought that he's just there trying to get publicity, it's like he would be behaving differently because there's avenues to publicity that he could take that he's not taking, right? Like, the reason he has a YouTube channel, you guys can all thank me for that, okay? I fucking made him build this thing. I made him make videos. This is all my streaming shit right now, okay? He's here largely because he's been prodded into it, and now he's found that he likes it a bit. The thought that he's fucking just this like clout chaser nipping at the heels of these amazing plant-based doctors is insane. He's a medical critic who's showing actual flaws in their methodology, right? Sorry, you say what you want, but I feel like I need to stand up for you a bit here because I know you're not gonna fucking sit here and talk about how great you are or whatever.
Yeah, I mean, like I said, Jeff, I'm just doing my hobby. I'm just trying to get to the truth of things, and yes, if people are wrong, I'll challenge them. I will. If I believe people, yeah, go ahead.
Sorry, I was just gonna, and just like with the funding thing, it's like, say Avi has all those bad intentions. He's just this clout chasing fucking who the fuck cares, right? It's like, what he's saying true? Maybe that's what you should focus on, you fucking idiot. Sorry.
Yeah.
Here you can see Dr. Avi is presenting his opinion about Dr. Ornish on Twitter. Dr. Ornish has backed out of having a discussion with me and has spread lies and misrepresentations about me to numerous colleagues of Belardo in the form of cherry-picked private email correspondences. This is disgusting and shameful behavior.
That's true. 100% true. I have that email. It was given to us by those colleagues. That was forwarded. Those lies were forwarded. I know it. Ornish knows it.
Yeah, and Jeff, you can cover for your boy all you want, but he's a fucking coward, okay? Avi would grab his testicles in his doctorly way to test for cancer or whatever, and then crush them. Metaphorically. That's what the debate would be, okay? Ornish was fucking horrified of Avi. Avi would stomp him through the floor. He won't enter a conversation because he knows he'd get wrecked. Same as you, Jeff. You're a fucking coward. So are all of these pseudoscience promoting fucking sophists in the medical community.
And further down, he says, it's time to expose the leaders of the vegan community for the pathological liars and manipulative bullies that they are. The era of pseudoscientists silencing those that defend the truth ends here.
So first of all, that's not later down the thread. That's actually a different thread. But yeah, that's also true. A true thing that you are providing evidence for. I mean, this is a problem in the vegan community. There are pathological liars, such as yourself. There are manipulative bullies in the vegan community. And there are people who try to silence the truth. There are people who do not care. They simply don't care about the truth. They want a certain narrative to go through, and they will just have this insane bias to defend it. It's a huge problem in the community, and yeah, it needs to stop.
And this is why it's so good to talk about discussion, right? What is the harm of discussion? If two people disagree and you put them in a room together to hash out their differences, that'll give everyone a chance to see what kind of view makes sense, what kind of view comes out on top, right? How do these perspectives interact with each other? That's what we would like to happen with the people promoting this kind of stuff, but they all run and hide from debate, almost as if people in Avi's camp kind of like have looked at the data and understand it supports them and feel comfortable defending it, and the pseudoscience promoters don't. It's almost like that's what's happening, eh? What a crazy theory.
This is how I view these kinds of attacks on lifestyle medicine doctors, coming from people trying to gain fame or raise their own status by
There we
going after
go.
respected
Mind
high-profile
He doesn't he
people
can't establish that. He's just fucking reading your mind.
with insults, name calling, and drama queening. And if you follow Dr.
There we
Avi
go.
and
Drama
Dr. Belardo on
Drama queen.
Yeah, I
Okay.
mean, pointing out that like a fucking anti-Holocaust movement is being hampered by pseudoscience promoting morons, right? Yeah, that's drama queening. That's not like having a concern for the truth and its effect on, an important movement that he's part of. That's being a drama queen, right? Yeah, that makes sense, Jeff. Defend your fucking idea. I can't stand this guy. It's like he sits here, all he'll do is character attack you, make, crazy fucking conspiracy comments, all this bullshit. But the bottom line is this, and this is all anyone should ever say, and a ton of people put this comment on his video, although he deleted a ton of them, but this is really like, there's so much wrong with Jeff that it's easy to just release like a fucking storm on him of like, here's all the fucking things you're wrong about, right? But really, this is what needs to be said. Defend your fucking ideas in an actual conversation. At least be willing to talk to the other side and see who makes sense. If you just want to exist in an echo chamber, fuck you. Stop striking from the shadows and come out and talk to the people who you're spending your time criticizing. Right?
On Twitter.
I think personally the main thing that Jeff should receive when he does this, at least, or anyone, frankly, this is my opinion on this. And it's hard to draw the line between don't go harass someone and like people need to be shamed, but yeah, I do like actually hold the position that this kind of behavior needs to be shamed, right? Like if someone is sitting there spreading just misinformation, right? Just lying about others, attacking them, and they will not give the people they're attacking the opportunity to defend themselves. It absolutely needs to be said to them, like, look, you're a snake, right? You just want to strike from the shadows, fucking avoid at all costs ending up in a situation where your feet can actually be held to the fire, where the people you're criticizing have a chance to defend themselves, right? That's what should be said to him. He's a coward.
You see that like and help promote these posts from a good friend of theirs, a crank named Kevin Bass, who posts these lists.
Is there an
He's
argument for that?
It's also like he's salty.
Oh.
So Kevin Bass made like a quack list, and he's on it, and he's salty at Kevin Bass, and also like Kevin Bass has attacked him before.
Yeah.
I don't know why. Yeah, I mean, yeah.
Of quacks. Here are a couple that get promoted. You can see it says nutrition quacks, Esselstyn, Campbell, McDougall, Greger, Barnard, and under not quacks, well, there's Dr. Avi. And then they push a list.
I don't know what this has to do with me though. Like this is not my list.
Yeah, this is Kevin's thing, but do you agree? I don't know all the people on this. The ones I know, I agree with how he's categorized them.
Yeah,
Do you think
I mean,
the list
I
is generally
think,
accurate?
I think the list is more. I mean, look, I don't know. I have to look with how there's a new version of that list every day. Like I don't know. I have to look. So if I say generally accurate and then there's a new version that comes out and everything's changed, I have no. But I think more or less like I do think Jeff Nelson is a quack. I agree with that. I do think that Esselstyn is a quack. I agree with that. Yeah, I mean, I do think that the claims of Ornish, yeah, I think a lot of them are quackery too. So
and this is how we'll handle this quack. Every time you make a video like this, Jeff, we're gonna just shit on you exactly like this, systematically debunk all of your claims and point out that you're a pseudoscience promoting coward who won't engage in discussion, right? And if you want to maybe put an end to this loop of shame that we're gonna keep laying on you, you could have a conversation, right? And if you don't want to, the shame's just gonna keep coming in.
Again, I'm just really not sure what this has to do with me.
Yeah. I hate people like this, man. Watching this video, I've become actually frustrated. Like, it's just utterly disgusting to me. The thought of dedicating your time to trying to affect how people perceive certain individuals or certain ideas and all this, but being completely unwilling to actually, stand up for your own ideas or your own attacks on those ideas in a context where it's not just you fucking preaching to the choir, right? It's like, it's just the epitome of like talking a big game and just like not walking the walk, right?
Yeah.
It's gross.
The
really
reliable sources under plant-based, and they have Dr. Avi and Dr. Belardo, of course, along with Ginny Messina. Now, Ginny Messina is a vegan dietitian who dismisses the lifestyle doctor's advice, and she pushes vegetable oils and higher fat processed foods like soy
oil.
products.
I was wondering when the no oil nuttery would come back.
Yeah.
Especially. And now I should mention that Ginny's husband, Mark Messina, has been a longtime lobbyist for the soy industry, and today he's executive director of the Soy Nutrition Institute.
Who cares?
This guy's thought process is like a fucking squirrel's nest.
An industry group to help promote and market sales of soy. So maybe Ginny lives in a house built by the soy industry, but she's...
What's wrong with soy?
This guy's just a fucking idiot, dude.
one of the reliable experts along with Dr. Avi and Belardo. I see that Robert Osfeld, who I like, is listed as a reliable source. When he spoke at one of my conferences a few years ago, he gave a talk based on what he had learned from Dr. Esselstyn. He even borrowed a number of Dr. Esselstyn's slides. Dr. Esselstyn,
many of which he has removed from his slide deck, by the way.
Again, not taking credit. Yeah.
Yeah.
After seeing your critique.
After seeing my critique, many of which he has removed.
Yeah, so keep sucking on Osfeld's cock there, Jeff. He agrees with Avi. How do you like that? Does that make you feel good? And that movie you shared, Game Changers, creator of that, hugely respects Avi, took from him. Right? How does that make you feel? Do you like knowing that? Fucking piece of shit. Let's keep going. He must hate it. It must trigger him so much to see people who he respects just talking to you, realizing you're right, and then agreeing with you. And then he has to throw them under the bus or rationalize why they're actually idiots. Imagine how painful, like, a reality that must be. Like, how painful a mental experience. Imagine living like that, where it's like you're having to, like, find reasons to discredit people you've previously liked because they agree with someone who you have personal problems with. Like, what a horrible fucking... Imagine being in that mind. I'm glad I'm not there.
Other doctors. And Dr. Osfeld's talk is on my channel, so I'm not sure why Dr. Avi might consider Dr. Esselstyn a quack, but Dr. Osfeld, who gives a talk based on Dr. Esselstyn's materials, is...
Oh, that's easy. That's easy because Osfeld conceded to the data.
They're two different people. They operate different ways. Also, I'd also just like to point out another problem. Like, you couldn't actually infer that I consider one a quack and not a quack based on this list, because again, it's not my list.
Right. But also just with Osfeld, it's like the fact that he and Esselstyn were making the same claims. I mean, that's not the basis for thinking someone's a quack, right? Like the distinction is that Osfeld was making the claims clearly out of ignorance of certain facts, which is not a criticism of him. Like, I mean, who the fuck would look into this? Whatever. But you know, it's like he was making them out of ignorance, and Esselstyn was making them largely, at least, out of ideology, and we know that because of how they responded when the debunk was brought up, right? Osfeld was able to be honest and go, oh, crap, there's a problem here. Removed the slides promoting the Esselstyn sophistry, and now he's on the side of, you know, science. He always was. He was just confused about something, right? That's fundamentally different. And that's understandable. Everyone's going to be confused about certain things, especially like highly nuanced little medical areas that may not be their specialty. They may not look into that exact thing. Like, of course, right? But it's like the paradigm they're operating in. It's like the mindset, right? Like Osfeld, I don't know him, but obviously if the kind of way he's responding to data is looking at it, evaluating it honestly, and changing his position, he's operating in a fundamentally different way than Esselstyn. And someone who's operating like that doesn't deserve to be called a quack just because they made false claims in the past. Crazy.
Right.
Here's a later iteration of the quack list. They included Dr. David Katz and Dr. Garth Davis. Under the quack side, yellow means recent addition. Along with me, I'm a quack too, according to their list.
Oh, he's
Thanks,
a complete
guys.
quack. But what is the deal with Garth being on there? I don't really know all the stuff.
I don't think he's on there anymore. I think there was so this is not a newer version. This is actually a very old version. And I don't think he's actually on the quack list, but I don't actually know because the quack list changes all the time. Again, not my list. I don't see what this has to do with me.
Very weird. Kind of goes off in these crazy tangents. But what actual data have we seen so far? It's like, you know, the only, again, just remember, right? Don't get distracted. But to anyone watching this, not used to philosophy or logic or whatever, don't get distracted by all this person's paid by this and this person has these motives and cardiology bad and blah. Just what's the data he's shown? The bit of data he's shown, he didn't even understand what he was looking at, and when we looked at the graph, it showed that he was fucking retarded. Okay, that's the actual data that's been given so far. Try to focus on that, not his character assassinations and ramblings.
I'm not a doctor, but I'm happy to be in the company of many of these folks here. But you can see the level that's at work here with some of these vegan conventional medicine doctors. These are Twitter doctors, meaning they're hanging out with other doctors in their specialty. Very
Twitter doctors, meaning they're hanging out with other doctors in their specialty.
Very weird thing to say. Is there something weird about hanging out with people in your specialty? Is there something weird about being on Twitter?
few of whom are also plant-based. So these vegan doctors can score points with their carnivore and keto social media followers.
What? I dunk on them just as well. What are you talking about?
Yeah, I mean, that's just
More
crazy.
mind reading.
Yeah, right. You're trying to appeal to the carnivores, right? It's funny also, it's like, does he... Yeah, funny, whatever.
Hot shots at the plant-based lifestyle medicine doctor.
No, that's okay. That's just, it's just so bullshit, because it's like, it's not like, oh, let me get in with the keto crowd by like taking Esselstyn down. It's like, it's just so insane to think that's where Avi's coming from. Like, A, you don't know, and even if it was where he's coming from, you know, that's the data that matters. Who cares if he's coming from a bad place? But like, B, it's obviously not where he's coming from, and the reason to think that is pretty empirical, right? Just look at his history of criticisms. It's like you've shat on tons of crazy carnivore people. One of my favorites, although he's not a doctor, is when you got fucking vegan phobic to say that he would eat fecal matter urine stew, right?
Oh, that was good. Those are good times.
Yeah. So just the thought that Avi is just, well, we'll just talk about you, I guess. The thought that you're just focused on criticizing vegans is just insane. It's like, what this is internal criticism that's much needed to purge pseudoscience, like the kind that Jeff promotes, from our community, right? It's very important to have someone trying to do that, right? That doesn't mean that's not exclusive to criticizing carnivores. That doesn't mean he's trying to build an audience with carnivores, right? Just like, I mean, and the funny thing is, Jeff would be able to understand this the second that we say there's someone in veganism promoting a claim that he clearly, he's doing it, right? This is funny, right? Because he's doing this right now. It's just, because I was about to say, the second that we give a case of someone in veganism promoting something that Jeff clearly thinks is false, he's going to immediately be understanding of that kind of internal criticism, right? And then it just occurred to me, that's like literally what he's doing here. So what the fuck is the problem with criticizing other vegans, right? If they're saying stupid shit, they're saying stupid shit, and it should be pointed out.
Yep.
Work. When I see conventional medicine doctors who are vegan joining together and promoting, their opinions as what vegan doctors are telling.
The vaccine talk. What was the problem with the vaccine talk, Jeff?
There's also a funny comment in here. Lol, Isaac is Avi's anger translator.
No, it's true. That's accurate.
Telling you about veganism or some such. It reminds me a little bit of what happened at the Nature Conservancy some years ago when they were taken over by anti-environmentalists. The Nature Conservancy is the world's richest environmental group. They've amassed billions.
I love this conspiracy theory about me. So there's this conspiracy theory that I'm like this fake vegan that has infiltrated the vegan community to try to like destroy it from within or some shit. Like I love this analogy. Like I'm the anti-environmentalist who assimilated into this environmental group, and I'm just taking it, spreading my tendrils and just taking it down.
Which, it's funny because despite like, I get tons of completely insane criticism, right? But a criticism I never get is you're not vegan, because I'm very like unequivocally and unapologetically vegan, right? It's like I call it a Holocaust. I pull no punches, right? It's absolutely fucked what we're doing to animals, and you should not be contributing to it if you're a remotely decent person. You're a scumbag if you are, right? I'm unequivocal about it. Well, if you are, and you know. If you don't know, you don't know. So it's like, this is one challenge I never get, despite all the other crazy shit that I get. And I would be able to vouch for Avi because I'm the one who made him vegan, right? It's like I was there watching the process happen because I made it happen. So I can tell you right now, the guy is vegan. It's like, and it was not a pleasant process either, right? For anyone who doesn't know this horrible experience, the quick version is just like Avi showed up. He had been arguing with my friend. Well, at the time he wasn't a friend. He's a good friend now, but my at the time patron and acquaintance Hammy, right? And Hammy couldn't really beat Avi, so he's just like, come to the Discord. And then Avi came over to the Discord and he tried to argue for carnivore stuff, and over time he just kind of like gave up on the position, basically realized he doesn't agree with it. And it was a very painful experience of going through like for me painful. I don't know what the fuck it was for you. For me it was atrocious though.
I enjoyed it.
Dealing with just more and more frustrating arguments attempting to justify carnism. So I can tell you, I watched this guy try as hard as he possibly could to find a way to defend carnism, and then eventually just give up and say, I cannot find a way to do this that is satisfying to me, right? So the idea that he's not vegan is just insane. I've seen it happen. All his his statements go against it. There's no evidence for it. It's just a crazy conspiracy theory. And again, it's irrelevant to any data that
and assets by pledging to save important places. And several years back, they decided to try a strategy to raise more money. They brought in the heads of some big corporations to join their board of trustees, people from companies you don't normally think of as environmentalists. I'm going to put a link in the description to some articles if you want, but what happened is these board members came into the Nature Conservancy and started projects like drilling for oil and logging on valuable land the Conservancy had purchased. And these board members started selling off pristine, beautiful land that the Conservancy owned to themselves and to each other. And they built huge mansions with tennis courts and swimming pools out in these wild, protected places. Here, this is from the Washington Post. The Nature Conservancy has often resold raw land at a loss to supporters as part of a program to limit intrusive development, but the sales generally allow buyers to construct sprawling homes with swimming pools on the environmentally sensitive sites. When the Conservancy acquired rare open sand plain on Martha's Vineyard, it hailed it as an important victory for conservation. While the Conservancy placed restrictions limiting some development, it also resold half of it, paving the way for Gatsby-esque vacation homes. So this group of corporate profiteers and raiders infiltrated the environmental group. They were invited in fact, and were turning it into something to benefit themselves. This was the fox guarding the hen house. The Conservancy later, cleaned up its act after this big expose in the Washington Post. They kicked out all of these people from their board. But in a sense, this is what I see going on in a smaller way inside the plant-based world.
What a delusional freak. I'm sorry. What an absolutely delusional weirdo. What planet is this dude on? I mean, yeah, that Danielle, Belardo, Garth Davis, and myself are like intruding into the vegan community to try to make it a non-vegan. I don't know. I don't even know what this guy's talking about. Like,
can I hear that again? Just the last few seconds there?
Yeah.
House. The Conservancy later, cleaned up its act after this big expose in the Washington Post. They kicked out all of these people from their board. But in a sense, this is what I see going on in a smaller way inside the plant-based world, at least in some quarters. Remember that lifestyle medicine doctors generally aren't pushing the idea that health is so complex that you need to, blindly rely on prescriptions and procedures and doctors. They generally want you to seize control of your own health, starting with changing your lifestyle habits. Lifestyle medicine
was that not, what was the part you were reacting to? Just him trying
the part
to
I was reacting to is like that he's saying the same things happening in the vegan movement.
That you guys are trying to do what specifically?
Well, he's making the analogy. You know how like with this environmental group, how like these anti-environment people came in and like, right, just destroyed it and just sold and turned it into houses and whatever. He's saying he sees the same thing happening in the vegan community with the conventional medicine vegan doctors.
It's hard to reconcile with what you're doing with most of your time, because like even if we agree that your medical takes on veganism put people off of veganism or something like that, like even if we say in some way it's anti-vegan, right? Let's just say that. The majority of the time you're arguing for veganism, right? Just watch like most of the debates. So how does he kind of square that circle, right? It's like even if you grant what he's saying about your medical claims, it's like, what about all it's kind of doesn't make sense, whatever.
So yeah, I mean, there's the conspiracy theory about me.
And
Yes.
doctors have that conventional medical doctors
Like, why can't
may
people
not.
just make? Why can't anyone make a good fucking video? Why can't you just like? If he thinks you're wrong, why doesn't he just go? Dr. Avi made this statement, like screenshot of the statement in context or quote or whatever. Well, here's the data behind that statement, and as you can see, it's false for this. Like, why is no one capable of doing that, right? Why is it so hard about that? Why does it have to be X as a shill and weird fucking analogies to the Nature Conservancy and false claims about Garth Davis's dad or something? Like what the fuck? It's crazy.
Not is full of healthy skepticism for research.
Oh,
paid for
this guy knows what healthy skepticism is, I'm sure.
Oh man.
I
and
really
produced
have faith there.
by drug companies. I see the vegan conventional medical doctors having much less suspicion about research and information coming from drug companies, or for that matter, from food companies. But drug companies.
Wait, we have retardation in the text.
That's
So we've got some retardation in the text here. Avi spends most of his time doing research trying to change people's lives. He's not drama queening. Also, Avi spends multiple hours responding to video released 11 hours ago to save his bruised ego. Nice mind reading. I don't know if you have any argument against any of the claims he made, but you have I'll give you 30 seconds in chat to say yes, the word yes, I have an argument, and then we'll watch you present it. And if not, you can get booted the fuck out of this chat. So we'll give you 30 seconds.
I'll also just add while we're waiting that those two statements are not incompatible. Like the statement, Avi spends most of his time doing research trying to change people's lives. He's not drama queening. And also, Avi spends multiple hours responding to a video released 11 hours ago to save his bruised ego. Both of those things can be true at the same time. Those are not like, you realize like multiple hours making a video, you can still have the majority of your time not making videos and doing other things.
Yeah, I mean, it's just such severe retardation, not understanding basic logic, like what kind of two things are mutually exclusive. So yeah, Dylan B, you still haven't given an argument. You seem to be Jeff Nelsoning in chat, which is just rambling about character, not giving any arguments. So you are going bye-bye. All right, sorry, I had to just deal with the retardation. There are some funny ones in here, though. Ornish will wipe the floor, ... for a living after Avi dismantles him. That was funny. Yeah, Belkin, of course we're going to fucking ban him. Look, we don't put up with sophistry here, okay? If people in this kind of situation want to, like, if people talking shit want to actually come debate, we will bring them into the call and they can try to defend their position. If they want to talk shit from text and not immediately the second I say give an argument, zero tolerance. You're just gone, right? We don't put up with that. We're only interested in interacting with people who want to actually try to defend or attack ideas, right? If you're just here to bitch and moan and have a little fit in the chat, yeah, I mean, you're gone. We don't have time for that. We're interested in serious interlocutors, so go fuck yourself. Do you want to continue?
Yep, sure.
People realize and acknowledge drug companies are not known for their honesty and integrity. Drug companies have killed millions of people, often based on cooked research or outright fraud, and that's why they pay tens of billions in fines and settlements after they kill.
He has an insanely one-directional take on drug companies. Like, I mean, they're companies. I'm sure they have the same kind of problems that companies have in a for-profit climate and everything. But it's like, why do we not hear any mention of all the lives saved by technology developed by companies? It's just crazy, right?
Thousands of people in a year. Don't get me wrong, I do like Garth Davis. I think he's a good guy, and he and other conventional medicine doctors like to write about and argue in favor of the plant-based diet, and that's great. But I personally don't rely on conventional medicine doctors and their worldview when it comes to educating about what are the healthiest plant-based diets and about what pharmaceutical interventions you might want to consider. On the other side, there are lots of plant-based outlets and people who are lifestyle medicine oriented.
You shouldn't do this for anyone. You shouldn't. I keep repeating the same point, but you shouldn't blindly trust any doctor to do this when they make claims. Yeah.
So here's one question someone might have for
Yeah,
you,
sure.
Avi. They might say, Well, like I agree. Let's not just like trust anyone, but like I'm not going to be able to do the work to learn to evaluate this information on my own. I have to make medical decisions. So what should I do?
Sure. So here's what I would say. If there's one thing you can do to determine like an expert to side with when experts disagree with each other, one way of doing that is to look at which expert is willing to debate the other experts and defend their view, and which expert is not willing to defend their view. That's one way when there's a controversial issue in medicine, and one side is willing to say, here's I'm right, here's why I'm right, and here's the data behind that, and the other side is not willing to do that. That's an indication of which side you should side with.
But
if you're not willing.
The thing is, like, in a lot of cases, they're not gonna. It's not even. A lot of doctors don't even do debates, right? You're a minority there. So if you just have, say they're just watching a bunch of presentations, you have some doctors saying something, some saying another. I mean, do you think there's a way to give them a heuristic there, or do you just think that's a genuine kind of epistemic problem where it's like, yeah, like people we need to raise the standard of knowledge in the population so people can actually like assess these things better? Or do you think there is some kind of heuristic you can give them for how to make
it's very, it's hard to do that. There needs to be more transparency with outcomes. There needs to be more transparency with price. There needs to be more transparency in the medical field with a lot of things. It's hard to give heuristics like that. One heuristic, the only real heuristic I can unfortunately give right now that I'm very confident in is that in terms of people, when there's a controversy on a certain proposition, a good heuristic are the people to go with the people who are willing to defend the view, rather than the people who avoid it.
Even that though, like, okay, I agree that probably points a bit one way over the other, but like there's crazy people who will defend the shit out of their views, right? Like there's fucking lunatics who will debate. Sure. Like, I mean, I do think it's a red flag. Like it's a huge red flag, obviously, when someone won't have a fucking discussion with the other side. Like that should be a red flag, but it's still, I'm just pointing out, it's still an imperfect heuristic. So maybe the fair take here is like, yeah, there is a serious question about how to tell someone how to make medical decisions really in any case about what to believe when it comes to science when they don't have the education to actually like assess the data. It sucks, but like the best heuristic probably is just go with like the medical consensus, just like trust your doctor. True. You're gonna get some amount of bad info that way, but if someone's literally got no training and can't assess the data, that's probably better than
guideline. I mean, the heuristics I can give you are guideline directed medical therapy, the guidelines in the given fields. The same guidelines that are written by the shills for the pharma that Jeff is talking about.
And the other thing to point out is, even if there is a genuine problem there with like how to tell people, who they should trust, or like if they because it's great to say, don't trust anyone, make up your own opinions, but for the people who can't, right? Like, I mean, even if there is a genuine problem there, it doesn't mean Jeff's right so about any of his claims. So it might just be there's a lot of people who just aren't going to be able to understand why he's wrong. Maybe that's just the reality, but okay. And that problem applies to both sides, obviously. It doesn't just apply to you. Okay.
Respect. Rip Esselstyn, Forks Over Knives, people like Spudfit, Andrew Taylor, High Carb Hannah, Jeff Novick, Anthony Lim, Chef AJ. One of my favorites, Robbie and Cyrus of Mastering Diabetes. They are reversing type 2 diabetes for so many people using the low-fat, no-oil, plant-based diet.
Oh, sorry. You can one or two people. Someone's asking how to donate. I think there's super chats if you want to donate. I mean, Avi probably doesn't need your money, but we'll read your questions or whatever. In fact, I tried to this guy, I saw his AdSense today. He's got money that's just built up sitting there that he hasn't collected. So that's another funny thing about saying you're doing it for money. You've literally never collected an AdSense payment. But yeah, you can donate with Super Chat. And we'll read the Super Chats at the end. Please, Avi, don't let that be a false promise. Please try to remember that, 'cause I'll probably forget, but we'll read them all at the end. Okay. And you got standard questions, is oil fine? What does he promote certain whatever? Okay, well, I don't know if we can address all those. If you really care, put it in Super Chat and we'll hit it at the end.
Okay, awesome. Yeah. I just want to go to my stream window. Okay, cool. We're still live, right? Okay. Cool.
Of course we're live. No,
all
I
right,
just
all right,
you know I just thought I'd stop there.
Yeah. All right.
This is what top lifestyle medicine.
Does that
doctors
window show you
recommend
super
as
chats?
the best therapeutic diets.
No, that's why I clicked out of it. I think I
Okay,
have to go
we'll
to
just do it at the end. You have to go to, you know where it
All
is
right,
though.
cool. Yeah,
Okay,
yeah. I think so. Okay. Let's just
For
finish up.
people trying to get well and stay well. And even some conventional vegan doctors recognize the incredible power of the low-fat, no-oil vegan diet. Here's one testimonial.
No oil.
No oil.
Mastering Diabetes has become one of the first resources I recommend to my patients. I recommend the Mastering Diabetes coaching program to every single one of my cardiology patients, as well as my cardiology and internal medicine colleagues. So Dr. Belardo does appear to recognize that these low-fat, no-oil diets are optimal for treating.
Nothing in that quote entails that.
Wait,
Nothing in that quote entails that.
Is Mastering Diabetes one of those programs though?
I don't know, but even if it is, it doesn't entail that.
If it's a program that promotes like one of the main things it promotes is like low.
It doesn't entail that. You can recommend this without believing that no oil is optimal.
Well, the other thing I know about Danielle is she used to hold some of those views.
She used to, yeah.
You know,
that's
similar.
the thing. Like, this could be an old quote. Exactly. This probably is an old quote.
Right. So like again, this is kind of a theme, right? Of there's people who are open to evidence and there's ideologues, and people like Avi are a really great kind of test for which camp you fall into, right? Because Danielle, she believed, I might be misquoting her, I think you can correct me, but I think she believed like all the like fucking no oil shit. She believes,
yeah, she did.
She
used
believes
to
some
believe
other
that,
crazy shit, I think too. And
Yeah.
her story, although I can't do it justice, was basically like she believed a lot of this stuff into being a doctor, and it wasn't until she did her like cardiology, I don't know what it's called, like an internship or something like
Fellowship.
Right, she ended up in like a room filled with like well-trained like you know cardiologists have been doing it for a long time, and she tried to bring up this info thinking like cardiology community just like doesn't understand, right? Like they're like missing like this, you know, all of this stuff you can do with like the low oil plant diet or whatever the fuck it was she was on about, and they just like obliterated her papers in front of her. And just like she basically, the way that I interpret her and she talks about is it was just like a very humbling experience, and she changed a lot of her views. So, you know, Danielle's an evidence-based person, right? It's like she's going to go where the data goes. So even if in the, like, I don't know exactly what Mastering Diabetes is. I guess if it's a program that has different, you know, elements to it, maybe she doesn't necessarily have to have been promoting the low oil part. But even if she was, I mean, it's like it could be a past quote, right? Like we know Danielle's current view.
We know her current view.
Maybe you can state it better than me. It's not
No,
no
it-
oil. It's like don't excessively
oil.
consume oil or something.
Don't
like,
guzzle it, but there's no case to be made to cut oils out of your diet.
right. And Jeff should take a lesson from Danielle and, you know, engage with critics and evolve his views accordingly instead of hiding in his echo chamber and preaching to the choir while dodging debate against anyone who could own him. You want to keep going?
Colleagues. So Dr. Belardo does appear to recognize that these low-fat, no-oil diets are optimal for treating disease. Bottom line, always be aware of the source if you're out to get reliable health information in the plant-based community. And in this day in social media, you might want to consider what Lao Tzu once said. Those who speak the loudest often have the least to say of value.
Oh, the irony, Jeff. The irony. All right, well, that's it for the video. All right, now how do I
That's
get
it?
to the,
That's the end?
Yeah.
That's
Wow,
it.
that
Please
is an
give this video a
ironic
like.
note to
You
end
can
on.
see
That's
links to other
hilarious.
All right, how do I get to
I think you can go to like, isn't it like, where the fuck are super chats now?
There
I
may
don't
not be any super chats.
I don't even
or maybe they
remember.
moved them. I don't even. We may not have any.
I mean, I know how to find it on my channel though, so I can just go and I can go and look. One sec. Let's close the Nelson video. Oh, got a bunch of code there. Let's see. Well, I can see where to find it on my channel, and then you can like do the same.
Sure.
Okay, so let's go dashboard. Where is it? Comments maybe? Held for review. It should be in here. I used to know this shit. There used to be a way to just see all the super chats. Is it in live stream?
Oh, comments. No, not that.
Oh, I know there's a tab somewhere that literally says super chats, and it has like all of the ones for a while. Is it in monetization? Oh, I found it. Yeah, I found it. Okay, so go to your creator studio.
I'm in there.
And go down to monetization.
Okay, I'm there. Oh,
Yeah,
I
third
didn't
option
set up the
over.
Google. Oh, third option over. YouTube will monetize your channel.
Oh, you don't have.
Oh, it's
yeah,
no
you
super
don't
chats 'cause I'm
have-
not monetized anymore.
Right. Okay. So it must be that you actually were at some point, because we used to read
I was.
supers, didn't we?
I was at some point. Yeah, at some point. I guess
Okay.
I'm not monetized anymore.
We're gonna do the fucking honor system here. Okay. We'll stay around for a few minutes. Tag Avi and ask your question. Okay. And we'll take like a handful. So if you did a super chat, you can post I did a super chat, right? And we'll well, no, you didn't. You couldn't have, but we'll
No,
still
you
take.
didn't. They couldn't have.
Right,
No, you're
right.
not allowed
So-
to super chat. I'm not.
Sorry,
I'm
apparently I
not
don't
monetized.
comprehend reality here. But yeah, if you guys want a question, you can ask it real quick right now. Idiot talking shit about guitars or something.
I don't know.
Yeah, I don't know. Well, you can give him a few seconds. Is there any other thing you want to say, like before closing off?
No, that's it. I just I wish
there are a few rolling in when you're done your comment.
Okay. Thoughts on Nick Hybert's cheese stuff? I've spoken to Nick Hybert. My view is that cheese does not break the relationship between saturated fat and LDL cholesterol, or ApoB for that matter. I don't see why I would believe that. It may blunt it, but it doesn't break it. The outcome-based data, it looks favorable to cheese, but there's no substitution analyses. So the question is, what is it favorable in comparison to? If you're replacing refined grains or donuts or whatever with cheese, I agree that probably will be favorable, but I don't think I suspect it will not be favorable if it's replacing like things like legumes, fruits, vegetables. And so cheese is not something I would recommend at this point in time.
We got I hypocrite. Yo, what up, LP? I actually had a nice conversation with him last time I talked to him.
Do doctors have an incentive to push drugs in the United States? No, I don't know. No, they do not. In fact, most doctors are paid salaried, so it literally matters not how many drugs they're pushing. And even if for fee for service, like we don't get paid per prescription. That's not how it works. What's your opinion? What's obviously going to choose an LDL? As I said, I do think that as the saturated fat in cheese increases, LDL will increase, just like anything else. The slope may not be as high as for other foods, but that relationship does hold. What's your opinion on butter alternative like margarine? Oh, I think they're better than butter. How come Avi doesn't believe in bio? Oh,
I think they might want a little more there. They probably also want like, is it good to consume a lot of like vegan margarine, or like is that a safe thing to do?
Like, oh, like with some in the diet, sure. I mean, there was if you look at the Leon Diet Heart study, they were actually one of their interventions was replacing butter with margarines, and they actually had outcomes as good, if not better, in some metrics than the Esselstyn study.
Mastering Diabetes. It's a book by Neil Barnard. Okay, so I didn't understand what it was. I thought it was like some kind of like intervention program or something. But yeah, fair enough. I think most of what we said about Danielle, I think all of what we said about Danielle still stands. So I don't think that's like gonna change any of our comments really. But thanks for the correction there. And I think Connor up here is agreeing with my point about crazy people being willing to debate, or maybe he was making the point before I made it. I can't tell. I didn't see the timestamp. But yeah, I think we agree that there's crazy people who want to debate, and that's not a perfect heuristic at all.
Sure. No. I agree. It's not like look, heuristics are not perfect. That's why they're a heuristic. If they were perfect, they wouldn't be a heuristic. So yes, obviously there's going to be a counterexample to every heuristic. Hypocrite says, how come Avi doesn't believe in biological sex? Well, that's not true. I do believe in biological sex. I just don't believe biological sex is binary.
And we have a kind of like lovable debate history relationship with IHIP. So I mean, I'm sure we can have another round if you want. It was really funny because when Avi started taking that position that sex isn't binary, just gonna be honest, our first reaction was like, we have to tell I hypocrite, right? Like, if anyone's going to just hate this position, it's like he hates the gender isn't binary position enough. He's gonna fucking hate. Well, you know what? Now we're gonna say the same thing about biological sex, but yeah. I mean, I'm sure you can have a discussion, or if you really want to debate about that at some point, how to reach out.
Is non-HDL just as good as ApoB if that's all that is available? I would go with ApoB, but non-HDL is better than just LDL. But actually, I have to take a look at the literature and review that to see if there's any comparisons between ApoB and non-HDL. But I think it really does come down to ApoB. Does Avi have a video on oil free? I've done plenty of videos on the oil nonsense. In fact, you can look at Debunking Jeff Nelson Part 1.
Yeah, the playlist. Look in the playlist section of the channel if you want to find that.
Have you seen the Mendelians on IGF-1 specific cancers? Seems like there is a causal relationship between colorectal cancer and probably for breast, prostate, but not for others. Well, the thing you have to understand about Mendelian randomization studies in IGF-1 is that it doesn't take the nature of the spike versus the chronic elevations into account. I agree that chronic elevations in IGF-1 may have a relationship with that, but that doesn't really tell me that these transient spikes and falls from postprandial effects on IGF-1 do anything of the sort.
Yo, I'm seeing a conflicting thing. Mastering Diabetes is a program by Cyrus and Robbie. I mean, do you know what Mastering Diabetes is specifically?
Yeah, it's a program and a book.
Oh, it's both. Okay.
Yeah.
So do we know which Danielle was referring to, the book or the program? It doesn't even fucking matter.
It doesn't matter. Who cares?
We like to be thorough, but it's like, what's even the point? Like, it doesn't change anything about her. It's like her position is just don't consume an insane amount of oil. She used to believe all the no oil stuff. That's the deal with Danielle. The details about what the fuck Mastering Diabetes is, and that doesn't matter.
Yeah. Okay, if you have a choice between an mRNA vaccine or traditional, both being efficacious, which would you go with? Well, if they're equally efficacious, I would go based on the side effect profile. And if they're both equally efficacious equally safe, then I wouldn't really care which one I would go with. I mean, again, my choice is not based on the mechanism it's operating based by, rather than the outcome-based data. Now, if you're asking me if there's a heuristic, I mean, there isn't much of a heuristic with mRNA vaccines because it's very new. But so far, both mRNA vaccines that are released are highly efficacious, shockingly efficacious, actually.
You can tell if something's good to do if Jeff doesn't want to do it, right? Like if Jeff's spending all his time on Twitter telling you not to take a vaccine, it's probably a safe bet to absolutely make sure you get a vaccine.
Yeah. Okay. I think that's it, and it is 12 a.m. in the morning.
Yeah, let's call it.
12, actually. Let's call it. Let's end the stream.
Oh, this one's a good one, though. Just one more for you, Avi. Saladino debunk not happening due to JRE removing it from YouTube, or still a chance it'll happen?
Yeah, there's a chance it'll happen. I'm not gonna lie, my motivation for it is lower because it's not on YouTube anymore. Joe Rogan removed it from his channel, and now it's just on Spotify, and we'd have to no one's watching this video on Spotify.
I don't know about that, dude.
So, I mean, maybe people will, but
oh yeah. You think Rogan's gonna move to Spotify if there's not a similar amount of views over there?
Oh, I don't know. He got paid a lot of money to move it to Spotify. That's the thing. So he has to take that into account too. He got paid millions of dollars to move to Spotify.
If any of you guys have more questions, take them over to the Discord. It's linked down below. Avi inbox where you can put them. So if they're not too crazy, he'll respond to them. Anything else, or you want to just call it?
Just this one more. What's your opinion on non-binary people? Since you don't believe in what? I don't believe in what?
Yeah, that's hard when you don't finish your sentence.
I don't have any problems with non-binary people. I don't believe sex is binary. Just to be clear on my view. So I do believe there are non-binary people.
But with respect to sex and with respect to gender.
Yes.
Yeah, right. All right.
Maybe my view was confused on. Okay. All right. See you later.
Yeah, it's been great. Fuck you, Jeff Nelson. You're a coward. Defend your position, or at least discuss with the other side. And yeah, that was honestly my favorite part was that graph. That was hilarious. So in fact, for an ending shot, let's just
put the graph.
Yeah, let's just here. We'll even like turn off the cameras, and this can just be a reminder to everyone that Jeff Nelson is fucking brain dead. The one attempt at data, or maybe there's more than one, but this was the only one I remember, was a utter fail. Okay, good stream, Avi. Have a good night, guys.
Great stream. Good night, everyone.